on August 29th and 30th before a 3-day weekend. This is where I remind the committee that Senator Baldwin scheduled this meeting at this time before your 3-day Labor Day weekend.
Say thank you.
And also on Representative Clouston's birthday, I believe. So sometime over lunch, we'll break out a cake and streamers, etc. But for now, let's call the roll to start.
Good morning, Mr. Chairman. This is roll call for August 29th, 2024. Senator Barlow,
Present.
Senator Bouchard, Senator Dockstetter, Senator Hutchings,
Here.
Representative Chadwick, Representative Clouston,
Here.
Representative Hornock, Representative O'Hearn,
Here.
Representative Penn,
Here.
Representative Trujillo,
Here.
Representative Ward,
Here.
Representative Bien, Co-Chairman Baldwin, Chairman Zwanitzer.
Here.
You have a quorum.
All right. With that, any opening comments, Senator Baldwin? I mean, I think this might be the last committee you chair at the end of the meeting. Okay. With that, anybody else have any opening comments? I'm looking at you, Clouston, because there's only about 2 of us coming back here in 2025, and you're one of them. So need you and Representative Bien to pay a lot of attention, and Representative Penn. So with that, let's do our first thing today is credentialing. LSO, do you want to kick us off? Anna, good morning. I'll let you have the floor.
Good morning, Mr. Chairman. Would you like me to go over just the changes to the credentialing bill or the entire bill?
How about a quick overview, cursory of why we're here, and then the changes from last meeting? And then I think the group will, I'm hearing that they all may be in agreement on some of the changes and we might be in a good spot. So yeah, just a basic overview and then some of the updates.
Okay, thank you, Mr. Chairman. So this is 25 LSO 32 provider enrollment standards. We've had a working group that's been working on this draft since the April meeting. So in subsection A, a health carrier is required to notify healthcare providers applying for credentialing that they've received their application within 7 days of receipt. And then they must determine if the application is complete. If it isn't, they have to notify the healthcare provider within 30 days of receiving that application. The healthcare provider must also send a completed application. The healthcare provider must send a completed application within 30 calendar days of receiving notice that the application is incomplete. And if they don't, the timelines start again. In subsection B, the health carrier must complete the credentialing process within 60 days of receiving the application. And then subsection C is where the changes were made. It's the only section in the bill draft that's changed since the June meeting. So in subsection C regarding reimbursement, a healthcare provider must have a contract in place between the healthcare provider and the health carrier before reimbursement will happen. Once the contract is in place, the health carrier must reimburse the healthcare provider for all covered reimbursable healthcare services, beginning with the date the health carrier received a completed credentialing application unless otherwise provided by federal law. In subsection D, a health carrier is not required to approve any application for credentialing. And then in section 3 on page 8, the Department of Insurance is required to promulgate any rules regarding a uniform credentialing application, and dental and vision insurance are exempt from that application. Section 4 provides that nothing in the Act will require a health carrier to violate or fail to meet a standard or requirement of a nationally recognized accrediting entity. Section 5 is an applicability section, and Section 6 provides a split effective date, and that is the bill.
Any comments or questions, committee, to start us off? President Clouston.
Thank you, Mr. Chair. And I just want to thank everyone who worked these last several months on the task force. You know, the goal here was to try to cut down the administrative burden and make it easier for healthcare providers to get credentialed and see their patients in Wyoming. So the working group, representatives from all the insurance companies, Department of Insurance, myself, Hospital Association, and Medical Association. So we've been meeting for months, trying to work out the details on this, and I appreciate everybody's hard work and where we're at on this bill. So again, I think this is just a team effort in Wyoming where we got everybody in the room and made a really good bill that'll work here in Wyoming. So thanks everyone for your work.
Okay. Any other questions or comments for LSO? Not seeing any. Senator Hutchins, go ahead.
Thank you. Can you hear me?
We can, yes.
Oh, great. I appreciate that. I do have a question. As I was going through the bill on page 3, lines 13 and 14, kind of perked up my interest. You say a healthcare provider shall not mean pharmacies and pharmacists. So I reached out to find out, whoa, what's going on there? I didn't think to speak to Representative Clouston. I wished I had, but we have already established that pharmacists and pharmacies are recognized as healthcare providers. And under this bill, it would contradict existing Wyoming law and disrupt patient care and negatively impact the state economy. And I have a list of why. So what I'd like to know is, number one, why they were excluded, and if there isn't a good reason why, I would like to later on, when we go into discussion, amend that portion of the bill and strike that those 2 lines. Thank you.
Thank you. I don't know, Representative Clouston, can you field that one, if you know?
Thank you, Mr. Chair. So I think it's something, this is new then, that we would have to look at and get some information. So I'll be interested to hear some testimony. Healthcare providers in the Wyoming statutes, are pharmacists and pharmacies, are they included in that definition? So I think we just need to do a little bit more homework then if that's going to be, tried to be included.
Okay. I know the pharmacy associations here, we could talk about credentialing, what they go through. Representative Ward.
Thank you, Mr. Chairman. Was this language included in the last draft we looked at?
Ms. Johnson, do you know the answer to the last 2 questions?
Yes, Mr. Chairman. So this language was within the bill at the last meeting. I vaguely recall in the first working group that that this language was inserted within the bill. And this definition only applies to this chapter, which is healthcare provider credentialing. So it shouldn't affect anything else in Wyoming statute. It's just as used in this chapter.
Perhaps during public comment, the Pharmacy Association will come up and can elucidate us some on their credentialing procedure. Any other questions, committee, before I open it up to comments from the room? Public comment on credentialing bill. Anybody want to jump up first? The pharmacist. Welcome. Right here in Cheyenne.
Thank you. Chairman, Committee, Melinda Carroll, Wyoming Pharmacist Association. This was brought to our attention earlier this week. I did float it out to the members of the association, and many of the members had issue with this because they do contract with health plans, because not everything that we bill is billed through prescription benefit managers. Some things are through medical. Some of the point of care testing that we do is through medical. Some of the administration type medications, the long-acting injectables for opioid use disorder, the antipsychotics. We also give immunizations that are billed under medical quite often, and we feel that this could potentially bring a problem with contracting with health plans in the future.
Suggested language then on perhaps how to fix it, or just delete that section?
Thank you, Chairman. Our recommended way forward is just to strike lines 13 and 14.
Any questions? The Pharmacy Association? Seeing none, we'll take up that amendment at the appropriate time. Other public comment on this bill? Everybody who worked on the working groups in the room, but Representative Clausen said it okay? Not seeing any. Going once. Going twice on public comment. We might have one on, well, Mr. Bully's come up. Do we have someone online right now, Katie? They registered, but I don't see them on there. Okay, move the show up. Mr. Bully, welcome.
Sorry. Mr. Chairman, committee members, Eric Bully with the Wyoming Hospital Association. I'm trying to remember when this was inserted, but I think it might make sense to hear from the health plans to see. I would say, though, that the work we've done mirrors what we did last time with a couple of our bills. We've worked closely together, very happy, and I think we've reached a consensus amongst all of the interested parties on the language that is contained in this final draft bill. And appreciate Representative Clauston for his leadership on this one. But I'll defer to these guys to address the questions brought by pharmacy.
Okay. Any questions for the Hospital Association while I have them? Don't go too far just in case then. Mr. Spencer, welcome.
Good morning, Ms. This mic is, there we go. Good morning, Mr. Chairman, members of the committee, Bruce Spencer representing the Mountain Health Co-op. We spent extensive time on this bill, and the language that was objected to was put in at the very, very start. And what I am informed, and very briefly, because we didn't know this was an issue until right before the hearing, but my folks are saying pharmacy's different. It's not the same as the credentialing for medical. I also, as a lawyer, would greatly contest anyone who says, well, if you don't include pharmacy in the definition in this particular section of the code, then you've excluded them from all the other definitions in the code. And that's simply not true. That is not legally correct. There is no issue with having different definitionals in different sections of the code. It happens all the time. That's why we're very specific when we draft definitions, because they mean things. But you absolutely have different definitions in different sections. So there is no problem with saying in this credentialing section that pharmacy is not included. That does not affect any of the other rights in any other section because they are included in all those other sections. So I think well, I know that is wrong legally. I am told pharmacy is different from medical credentialing, which is one of the reasons why they were excluded this bill. We were working with hospitals and medical providers in this bill, and that's why we excluded the pharmacy up front. If you include them, it necessitates us going back to the table and having a lot of discussions. Because I can tell you the PBM that my client uses has concerns, and I certainly know other PBMs have concerns. So it sort of puts us back at, frankly, square one on negotiating the bill if they're included, whereas right now, with the language that we have, and due to the hard work of everyone involved and Representative Clauston, we've got an agreed bill, and I think it's a good bill. But the other requires us to go back to the table, I'm afraid. Thank you.
Questions for Mr. Spencer and Mountain Health? Seeing none. Mr. Walker.
Woo-hoo.
Go ahead, Senator Hutchins.
Thank you, Mr. Chair. I appreciate that. And sorry, I have to kind of yell out. I know your focus is really not up on the screen. But Mr. Spencer, when you say, well, if we include the pharmacists, we're going to have to go back to square one. Well, we're actually here to try to do our best to create the best possible pieces of legislation possible. And if we have to go back to square one on issues, to me, I don't mind. Representative Clausen admitted that that wasn't something that was brought to his attention at the time. He may not have been aware of the work that's been done to make sure our pharmacists are included as healthcare providers. So for me, if you have to go back to the table, and start all over again, that wouldn't bother me one bit. If you're gonna do something that may possibly affect a group of our economy, especially our dear pharmacists and pharmacies. So with that said, what would be the big problem with going back to the table to create a very, very good bill instead of something that's going to be in question throughout the session?
Mr. Spencer, I guess the question is, what level of difficulty do you think it would be to go back and reassess if we included pharmacists?
Mr. Chair, Senator, thank you for the question. My understanding of the legislative process is that this is the last committee hearing before you can have a committee bill. And so if our necessary request to sit down with pharmacists and hospitals and providers to rework the bill to address pharmacy concerns is met, then I don't think you have time to submit a committee bill. That was my understanding. Hence my concern about having to meet again. I have no concerns about trying to negotiate bill language, none. I would disagree with the senator. I think this is already a very, very good bill. I also think it does not do any harm to pharmacists whatsoever. And I can't be more clear on that. This bill does no harm to pharmacists. And so I think we've already got an agreed bill that solves a major problem for medical providers, and I think you should go through with it. And then if other negotiations need to happen, then fine, we can certainly have those negotiations, and perhaps amendments can be brought during the session. But if you want a committee bill that we have all agreed on, this would be the bill.
Okay, follow up. Go ahead, Senator.
Thank you, Mr. Chair, and thank you, Mr. Spencer. But committee meetings, having a bill being labeled a committee bill means really nothing really to me when it comes to doing what's right. I'd like to have it removed for the sake of voting on it. And then maybe in the background, if you and the pharmacist can get together and say during session, when we come back for labor and health in the winter, then possibly we can add it back. I would rather pass something that I felt good about than pass something that I'm going to always be in doubt that we need to take that out. So would you be willing to sit down with the pharmacist and hash that portion out? And then if we need to, I would rather, again, delete it today and bring it back during session so you can get your committee bill. Thank you, Mr. Chair.
Thank you. Mr. Spencer or Mr. Bully, go ahead.
Mr. Chairman, committee members, so we've worked tirelessly on this bill, and I don't want to get sucked into this PBM battle, and I think that's exactly what's happening here. This is a really good bill. We've worked really hard on it. It's really important to the providers of our state. So my solution or my suggestion would be, let's pass this, and then let's talk during the interim before we get to committee and figure out what we can do. I think it makes sense to leave the bill the way it's been worked for the last half of a year, and we can have those conversations. But obviously, this is the whole PBM battle all over again, and I don't want to lose a really good piece of legislation over this. I think we could have those conversations, but no conversations have ever been had. And this has been posted, it's been out. We've worked at 2 different committee meetings. I just think it makes sense to continue forward. Let's pass it, and then we can have these conversations, and we can amend it as we get it into committee and into the session this next year.
Okay. I see Ms. Mack is online. Would you like to go first, Mr. Red, or you want me to defer? Depends when you want to jump in. Now is good. All right, Rocky, go ahead, and then we'll go online after.
Mr. Chairman, thank you. I just, going back to.
And if you'd introduce yourself for the committee.
Oh, sorry.
We all know you, but for
Sorry,
the record.
thank you, Mr. Chairman. My name is Raymond Redd. I'm the General Counsel for Blue Cross Blue Shield of Wyoming. Thankful to be here today, and honestly, we have had a lot of discussions with the Hospital Association, the Medical Society, and industry, and those discussions have been good. I would also commend Representative Clouston for the efforts that he put forward in this. We did spend a significant amount of time, blocks of hours of all of our time to go over this bill and to make concessions on both sides. And one of the things that I would like to say is that open communication among various stakeholders in legislation is paramount to passing good legislation. And that would include cooperation with regulators and others too, so that everybody understands exactly what's expected. With respect to the proposed amendment to the bill, I think that that will be disruptive to the bill itself because of the construction that we went through to make this bill appropriate for health insurance companies and credentialing. Many of the provisions in there may not just directly transfer over to, say, a PBM or a pharmacy construction. And we can get into the details about that if we'd like to move forward with this, but I think the bill itself and all the time that we put into it will probably need to be significantly changed if we make this amendment. Thank you.
Thank you. Questions for Blue Cross? Seeing none, Ms. Mack. Oh, Senator Hutchins, you have a question for Blue Cross. Go ahead, Senator Hutchins.
Yes, Mr. Chair, thank you. Raymond, I believe it is. One of the things that I'm concerned about, and this kind of goes to Mr. Bowley's comments too. Yeah, a lot of things are put out there online for people to read, and they're available at any time. But my life in particular was disrupted this summer. That's the reason why I'm not there. A lot of things are going on where I can't always do the things I want to do for the legislature. But when I picked up this bill after I got my booklet, I read the bill and my eyes, when I saw it, I was concerned about that section on page 3. No PBMs called me, no pharmacists called me. I reached out to them. I don't think this is a PBM issue. I just think that we went through a time, and I can't remember when it was, when we made it clear that pharmacies and pharmacists were healthcare providers. That's why I said, wow, something's wrong here. So, Mr. Raymond, I would like to know, were pharmacies included in on the handiwork on this bill?
Mr. Redd, if you know if pharmacists have been in the conversation at all.
Thank you, Mr. Chairman. Senator, I appreciate the question. Quite frankly, I can't answer the question directly. I believe that the bill has been in the committee for a significant period of time and that stakeholders were invited, and that to the extent that additional pharmacists would have liked to have been involved in those discussions, they may very well have been invited or allowed to attend. I myself did not, make it a point to ask for their attendance or seek their attendance, but I definitely, on my part and for my client, made sure to be there, made sure to be aware of the bill, made sure to be present during the discussions on the bill so that I could have input and provide input for my client. So I can't speak on behalf of other pharmacists.
Okay. Thanks. With that, Ms. Mack, are you still available? Okay, floor is yours. Go ahead. Welcome.
Thank you, Chair Zwanitzer. Michelle Mack, the Pharmaceutical Care Management Association, otherwise known as PCMA. I appreciate the opportunity to talk to you today, and I apologize that I was not in attendance. I'm just monitoring from my home in Minnesota. And the reason why I'm just monitoring is because from the very beginning that we started having discussions about this, pharmacy has been excluded. I do want to also, agree with what Mr. Spencer said relative, and to what Mr. Red said relative to, this having, we've been talking about this all actually since April. And actually the Board of Pharmacy is, my understanding is the Board of Pharmacy was actually, at some of the committee meetings and was chatting about this. And also, and he actually told the stakeholders to all work together, which we all did. And like I said, that pharmacy has been excluded. Pharmacy is different. Yes, pharmacists are healthcare providers, but when we looked at this bill and when this bill was discussed after pharmacists were excluded or exempted, it was really based on the facilities in hospitals and in clinics, not in a pharmacy, because pharmacy is just a little bit different. And in addition, there was a meeting where, we all talked about this. So that, like I said, I apologize that I'm not there in person, but this is something that we have agreed to. Of course, we will definitely work together, but I feel that there are things that are very different and very unique to pharmacy that is different, that will have to be worked out to make this bill go forward. And I don't want to do that because I know how much work everyone on the ground has put into this. Thank you.
Thank you. Questions for PCMA? Go ahead, Senator Baldwin.
Thank you. I would have a question for you, and that is a question, if we go to that language in question on line 13 and 14 about healthcare providers shall not mean pharmacies and pharmacists. If we were to leave pharmacies in there and take the word pharmacist out, because as I recall, and I could be corrected, but the language you did on the bill where we include pharmacists as healthcare providers under the Medicaid, they're listed as Medicaid healthcare providers, which is the bill that this committee passed. Pharmacy was not on that list, just pharmacist. So if we were to leave pharmacies in there, how much does that change the bill and exclude pharmacists and include them in the bill here and just taking the pharmacies, excluding them as not being a healthcare provider?
Ms. Mack, if you know off the top of your head.
So thank you, Chair Baldwin. So how it works is we contract, the pharmacists and or the PBMs and the insurers contract with pharmacies, not pharmacists. So technically that won't clear it up because our contract is with the pharmacists or pharmacies, not an individual pharmacist. If that clears it up for you at all.
Helps me. Go ahead, Mr. Spencer.
Mr. Chair, Senator Baldwin, there are provisions in this bill about requiring a provider to have contracted with the insurance company to be part of their network. And if you include individual pharmacists rather than a pharmacy, you now have internal conflicts in the bill that we would have to completely rework. There was a legitimate reason why pharmacists and pharmacies were excluded, and that's just one. There are other instances where we would have conflicts that we would have to work through if we even could.
All right. Any further public comment from the table? Questions for any of the members of the dais? Representative Hornock.
Thank you, Mr. Chairman. Just remind me what happens currently in order for somebody to be enrolled and licensed. What do we do now? How does this bill solve the problem as well? Is it a shotgun approach? Are we trying to uniform the standards? What happens now and how does this help?
Mr. Boley, perhaps could you give us a cursory overview of the process now that there is some difficulty with and what we hope to achieve with this bill?
Sure, Mr. Chairman and committee members, Representative Hornock. So I think we described this in our first meeting, but currently, if let's use physician, new physician comes into the state and wants to begin practicing medicine, they're required to go through a credentialing process. And right now with each insurance company, that credentialing or enrollment process is different. Their applications aren't uniform. There are no standards in place on how long that process should take. And so they contract, they may come in as a contracted employee of a hospital, or they may be independent, but they have to go through this process before they can be reimbursed by the insurance companies. And so what this bill addresses is it makes a uniform application process for all insurance companies. We're hoping to have that be online, so it's even easier to access. It has timelines put in place on how soon or how quickly that process has to be completed. It puts onus on both the provider and the insurer to make sure that they both are meeting timelines, and it requires that the provider, the physician or other provider, get this done in a timely manner and complete the application fully. And then it starts a clock that the insurance companies have to follow on how quickly that process has to get done. It also addresses with Section C that if they are contracted and then they do the credentialing process, they'll be paid back to the date that they'll be retroed back, assuming that they have that contract in place. Otherwise, they would not be retroed back until that credentialing process and contract is complete. It's pretty high level, but I don't know, did I miss anything?
Mr. Spencer?
Mr. Chair, you know, the concerns about the process now for this bill are that a provider or a hospital on behalf of a provider will submit a credentialing application. Let's say it sits for a fair period of time, and then it comes back and they say, well, your application's incomplete. So you got to start over, resubmit, and it can take a very long time for a provider to get credentialed. And all during that time, that provider who the hospital has hired isn't able to bill. So at least insurance companies. So they're not able to provide services for in-network members for my insurance company, and they're not enabled to bill my insurance company. And that's not a great thing. And so this bill seeks to solve that for both sides. It puts those timelines in, because right now, nothing in this bill is law, and no one's required to follow it. Some folks do, some folks don't. But this bill requires everyone to be on the same page. And we worked very hard to come to agreement on the bill. We're all colleagues. We certainly could go out for the beer after we had our meetings, but there were some very tense meetings about this bill. That's expected. That's not a problem. But yeah, it solves some problems that frankly need solving.
Success. Okay. So you're pointing at everybody's point. Representative Hornak, follow up.
Thank you, Mr. Chairman. Yeah, you can't see the little light on the top. So and thanks for the refresher and going through that. So it seems like the major problem is just the timing. But it seems like this bill does a little bit more than just solve the timing issue. So why couldn't we just work on solving the application timeline type of thing with the, you know, where with that? And then, you know, I guess I have a question as well on top of that. This seeks to provide a uniform credentialing application that goes through the Department of Insurance. So, which might be the right place, but seems to me like what happens now is various insurance companies say, I'm a doctor seeking credentialing. Say, I want to work with one insurance company and I want to be credentialed through them, but I don't want to be credentialed through another insurance company because I don't like what they stand for or what they push me to do or something like that. As well, we're establishing in this bill, not just the timing of things, but we're establishing something within our Department of Insurance. And what happens in, I don't know, next year, 10 years, 15 years, whatever, where our Department of Insurance requires, in order for a doctor to be credentialed, they require them to perform abortions, or they require them to do something along that nature that a doctor might not stand for. They then lose the ability to pick and choose, I guess, with their credentialing. And so, I mean, those are kind of my concerns with the bill. It's more than just timing and what happens in the future when we standardize a uniform credentialing system and don't allow the free market to kind of have their say.
Mr. Chairman.
There's a question in there, yeah, go ahead.
Representative Hornak, I think you've conflated this a little bit. The only role that the Department of Insurance is going to play is creating a standardized form that would then be used by all the insurance companies. It has nothing to do, they won't direct care or any of that. We're just coming up with a standardized form so that you as that provider can apply to whatever insurance company you want to be covered by and be paid by. The Department of Insurance won't have any say in what you're required to do by those insurance companies. They're just, we're just using them as a vehicle to create that standardized electronic form so that we can make this more efficient and speed up the process to get providers enrolled and credentialed with whatever insurance companies they want to be credentialed by.
Let me go to Senator Hutchings next, and then we'll get back to Representative Clausen. Go ahead, Senator.
Thank you, Mr. Chair. And gentlemen, to my surprise, as the more you speak, the more it's coming back to my remembrance what exactly we were doing at the beginning with this bill. And some of my concerns are kind of deflating. But what I'd like to do would be to ask if we could, Mr. Chair, get the pharmacy representative back up in the seat and let us know what she feels now, having heard a little bit more about what we're trying to do here, to let us know if her fears possibly or concerns have come down just a bit. And then I'd like to know, once she talks to us, if this bill does go forward, I'd like to have the reassurance that the group will get together, or the gentleman here with the pharmacists, to make sure that they understand, like I'm starting to understand a little bit more about what's going on here with this bill. So can Mrs. Carroll come back up and then answer some of those questions along with the gentleman?
We will certainly invite her up
Thank you.
after this round. Anybody else have questions for the Hospital Association or insurance? Representative Clausen, go ahead.
Thank you, Chairman. Just a comment on Representative Hornak's question. So what happens now is if I bring in a provider and there are 7 insurance companies in Wyoming, we have to fill out anywhere from 6 pages to 15 pages for every single insurance company. So what this bill would do is the Department of Insurance will have one form that you fill it out once online and you're done. So that'll cut down everybody's paperwork. And then you sign a contract with the insurance companies that you want to deal with. You don't have to deal with them all. You don't have to sign a contract. Some have some rates in Wyoming that I don't accept, so we don't sign a contract with them. So it's not forcing you to be with any insurance company. It just streamlines the process that you can fill it out once and be done, and that'll save everyone a lot of time. The other thing is right now it can take up to 6 months to get a provider credentialed. This gives them a 60-day window. So that's 4 months of, sometimes I'll have a provider waiting to see a patient from an insurance company that they can't because the credentialing hasn't been done yet. So this will put timelines on there and allow our providers to see patients a lot faster in Wyoming.
Hopefully. Go ahead, Mr. Spencer.
Mr. Chair, Bruce Spencer. I also wanted to comment on Representative Hornak's question. You had mentioned your concern that part of the credentialing process might be that a provider has to offer a procedure. You mentioned abortion. I have never seen, as part of credentialing, any requirement that a provider offer or perform certain procedures. That's just not part of the credentialing process. Also, in my opinion, all the department is doing is creating a form, okay? It's this legislative body that has the ability to come in via a statute like this and say, if you wanted to mandate that a provider do something for credentialing. Frankly, we'd all oppose that because that's not really what credentialing is about. What credentialing will do is say, all right, if you are a specialist, then you've got to prove your education and you've got to prove your board certifications so that we know as an insurance company you are competent to perform that specialty. It doesn't discuss that you have to provide certain procedures. That is not part of credentialing. And I know that's a concern, and that's why I wanted to make sure if it's crystal clear, that's not part of the credentialing process.
Go ahead, Mr. Red.
Mr. Chairman, Representative Clouston and Representative Hornock, yeah, I want to just agree with the comments that Mr. Spencer has made. The contract that the providers sign is really the governing document that would discuss procedures or anything like that that may be reimbursable. But even the contract itself would not require a provider to provide certain types of services. With respect to credentialing, I agree with the comments that have been made. And, you know, the insurance department was with us in our committee meetings and has agreed to work with us on this. I think part of the issue is that it's a complex issue to deal with a credentialing application. We've moved on in technology, and I think members of this committee brought that point up before. So we need to have discussions about the use of technology in a credentialing application and how to standardize it so that it will be a good fit for facilities and individual providers. And those discussions are going to take time. And we're willing to sit down at the table and do that, but it wasn't something that we could put in legislation and draft at this point. But again, on the bill itself, which the uniform application is part of, you know, we really took a scalpel approach here. And as industry, we understood the need from, you know, the provider community to create some certainty. And so we made concessions to create certainty on timing and other issues. And I think, you know, we worked well together. So I just wanted to make those comments. Hopefully that's answered some questions. Thank you.
Thank you. Representative Hornock, question.
Thank you, Mr. Chairman. So I'm curious as well, as an insurance provider, wouldn't you prefer to kind of set your own standards rather than leave it up to the state licensing department, whatever department that is? Wouldn't you kind of prefer to make your own form, build your own form? I mean, what if the department leaves some things out that you really need that type of information before you start to reimburse a provider or approve an application? I guess I'm just curious why we're taking it out of the private industry and putting it in the hands of government to solve this problem. It seems the main problem is the timeline. But this does so much more than just solve the timeline. We could have a bill that just says, you guys have to get whatever application you provide, you guys have to get it done in this amount of time. This is your timeline, period. I think we would probably be more inclined to dealing with that in legislation. But I'm just curious, from an insurance perspective, why do you want to leave this up to the hands of a government agency rather than do this internally, do this in-house with the money that you have to work with? And it's part of your business, it's part of your overhead, it's part of your profit-making system. This has a lot of effects on all of that.
Was there, I'm not sure there's an official question there, but if anybody wanted to respond, you're welcome to.
Mr. Chairman, Representative Hornock, I think just based on that commentary, I can just sort of reiterate what has been said. Representative Clouston mentioned that, you know, it can be difficult for providers at times to have several different applications that they need to fill out. So I have sympathy for that and understand that there is some need to streamline the process. Running a business and providing health care to individuals and making sure that they're receiving it when they need it at the appropriate time and that the care that they're receiving is appropriate is a very important thing. And as a health insurance carrier, we understand that as well. But I also do have a little bit of sympathy for my own organization. We like our current credentialing application. We think it actually is pretty streamlined. And, I think I mentioned this to the committee before that, when we go to grad school or law school, there's not a uniform law school application that we have to fill out, certainly. I mean, they're all different and they all take time. But that being said, I mean, we're talking about healthcare here and it is important, and certainly don't want to minimize any of the requests that are made to make sure that the process is efficient. And there are uniform applications out there right now. There are states with uniform applications. There are electronic programs that providers already use that could be adopted. So certainly it's a complex issue. We have to credential providers for various different lines of business, whether it's a federal program and they have to meet the requirements thereof, or the Affordable Care Act, or any other program. So there are differences. So I think there's some complexities there that need to be addressed if we are to move forward with that part of the bill. And as I mentioned, we're all in support of that at this point, and have considered your points.
Okay. Seeing nothing up from this side, Representative Mr. Boley, one more time.
I'm not representative, thank you. Mr. Chairman, Representative Warren, I think the other thing to say is we wouldn't be here if we didn't need a solution. We wouldn't be here asking for this. The current process where there are multiple applications doesn't work. And so to have a standardized form where we can make this efficient, where we can get patients seen quicker, where we can make sure that all the information required by every insurance company is provided right up front, so that we don't have denials and we don't have providers waiting 120, 160 days to start their practice. It's a good process, and that's why we've all come together to work on this. And having whoever it is, I mean, I don't care if Blue Cross Blue Shield takes the lead on this and gets consensus from all the insurance companies about one form. It just made sense to have the Department of Insurance, as we worked with them, to be the ones that would come up with that standardized form. And if they want to go out and plagiarize it and take that form from another state, we're happy to do it. We know there will be a little bit of upfront work, but I think overall it's going to improve healthcare, the delivery of healthcare in our state, make our a much more attractive place for providers to come and work.
Okay. All right, we'll let you off the hot seats. Thanks. Other public comment, we'll get pharmacists back up in a second. I don't see anyone else online raising their hand. Anyone else wish to comment in the room? I guess we'll have Ms. Carroll come back. And I know you heard a lot of commentary, so I'll just give you an open floor to try to address all of the concerns you heard and what you think might be the right way forward for your organization.
Thank you, Mr. Chairman. Again, Melinda Carroll, Wyoming Pharmacy Association. I would just like to state that I understand that my colleagues have worked very long and hard on this. I apologize that I was not aware of this was in that bill. I also work as a full-time pharmacist, so I don't get to spend my time going to committee meetings all the time. I can also say that the Pharmacy Association was not contacted, and the Board of Pharmacy plays a role in patient safety, not advocating for pharmacy. In fact, they cannot advocate for pharmacy. So consulting with the board is probably the inappropriate place to go for that. It would have been the association. I appreciate that they said that pharmacy is different. They're right, pharmacy is different. We contract with both medical plans and PBMs. I cannot state this fact any clearer. I have pharmacists currently that are credentialed through medical insurers and provide service. This bill would mean that they can no longer do that. And I mean, it's that simple. So it's unfortunate that there was a lot of time and work put into it. I still think that if this bill goes forward with that language in it, the Pharmacy Association will be in opposition to it, and strong opposition to it. I am very sorry about that for my colleagues that have worked hard on this, because I do see a need for it. I do see that the credentialing does need to happen quicker. However, you're excluding a group that currently credentials. So that's where the problem lies.
Questions, Representative Clausen?
Thank you. Thank you for being here and your comments. So appreciate, what you're fighting for and, and representing. So if pharmacy is excluded like it's currently written, so pharmacy would just continue to do their credentialing process as they do now. So it would not be any different for pharmacy. You just would not be included in this part of the bill. So your current credentialing process, what is that like now with, because pharmacy is different, the way that you have to credential with the different, through the PBMs and the insurance company. So can you describe a little bit of what you do to credential now as a pharmacy and a pharmacist? And then if left out, that would be the continued process that you would go through.
Ms. Carroll, if you know.
Chairman, Representative Clauston, thank you for your question. Currently, the credentialing process that a pharmacist or pharmacy goes through is identical to a doctor, a healthcare provider. That's the credentialing that they have to do when they're contracted with a medical plan. It does take up to 6 months sometimes. My membership concern is if that is left in there where it says shall not be a pharmacist or a pharmacy, that would mean that they can no longer credential at all, because it is explicitly excluded in this bill, saying that we are not healthcare providers, which that statement in and of itself is troubling to me. I agree that it's difficult to move this forward if you guys change it. I understand the health plan's concerns about it. I do think that this refers to health plans and not PBMs. So I would say that we are not trying to drag the PBM problem in. However, apparently PCMA was in discussion with everybody, which is interesting to me. So again, this is pharmacists providing services to your constituents, point of care testing, strep testing, flu testing, giving immunizations. We do genetic testing even. So we provide a lot of services, and this could potentially mean that those services would no longer be available to the community, because you're not going to do them if you can't contract and you can't get paid. And those pharmacies would lose that revenue stream, putting them in a worse off position.
Okay. Other questions? Representative Yen?
I mean, I guess it's not a question. So I'm trying to place.
Okay, so we're at questions, so we'll make it a question.
Thank you, Mr. Chairman.
Go ahead.
My question for you, Ms. Carroll, is I'm trying to place where it would make it so pharmacists could not get credentialed anymore. I understand that you're saying that if you remove it from, if you explicitly exclude them from the definition of a healthcare provider, they wouldn't fall under this bill. But if they don't fall under this bill, it just means that it's not Chapter 56 version of healthcare provider credentialing. So it still would be credentialing outside of Chapter 56. It just wouldn't fall under the regulations required for both the insurer and the pharmacists who are not included in the bill. Do you think that, I mean, let's say we do include you in the bill, do you think that it would make it faster for credentialing? And do you worry that, on the flip side, do you worry that pharmacists could not necessarily provide the information needed on the flip side for a healthcare provider to provide to the carrier to make sure that the process goes smoothly? So do you think that the pharmacists who would be included, if we do include them, could uphold the rest of the bill as well?
Ms. Carroll.
Mr. Chairman, Representative Yen, thank you for that question. Currently, pharmacists still in credentialing get denied sometimes because of their taxonomy code. So we already struggle to get credentialed because of being seen as not healthcare providers. And so having that statement in there is, again, troubling to myself, my membership. They believe strongly that this will affect their ability to credential. With that, if I think removing them, yes, we're already doing the credentialing process currently, the way that it is. Is it lengthy? Does it delay care for people? I'm sure. However, I would rather have a guarantee that we can still credential instead of being questioned if we're a healthcare provider.
Okay. Seeing no, Senator Barlow.
Thank you, Mr. Chairman. So I appreciate this discussion, and I hope the bill advances in either form, because there will be lots of discussions either way. But just to Ms. Carroll's, where the comment was made, it's been made several times about requiring or changing some of these carrier agreements or things like that. If you take up page 6, lines 7 through 9, this does still not require a health carrier to approve an application. So I think let's keep the context in. This is just a process bill, not a outcome bill. At least that's my understanding when I read that. So I certainly, like I said, I understand the concern with the pharmacists are bringing forward, and maybe there's a way, and I'm looking for a way to try to address that in a different spot besides the definitional part of it, because that's probably one of the more challenging things, is because that's in a definitional part, how it's construed does maybe leave some people concerns. But nothing in this bill requires a carrier to approve a credential. I just want to be clear about that based on the last comments. Thank you, Mr. Chairman.
Thank you.
Mr. Chairman.
Yep, go ahead, Ms. Carroll.
Senator Senator Barlow. With that, I'm just saying it's not a guarantee. We know it's not a guarantee. We're saying it's already a challenge with some insurance carriers to get credentialed because of our taxonomy. And this bill will potentially make that even more difficult. And it will make it so those pharmacies cannot provide that, well, will not provide that care because they're not going to get paid for it. So it's as simple as that.
All right. Seeing no questions, thank you. Those comments, and I think we understand that concern. Any other public comment online? There are a couple people I thought registered but didn't want to jump into the room. Mr. Spence, you're coming back for bite 2, huh? We'll make it quick. Welcome.
Mr. Chair, my apologies, but I do feel I need to respond to Ms. Carroll's comments. I think that Representative Clouston, Representative Lynn, and Senator Barlow have it correct. This is a process bill. All it does is put some sideboards on the credentialing process for medical providers. It does not, in any way, shape, or form, prevent pharmacies from getting credentialed. That language is not in this bill. Insurance companies have to have a certain number of pharmacies in their network to meet federal and state network adequacy requirements. We want insurance pharmacies in our networks. As a part of that process, pharmacies are credentialed. I'm told it's a bit different than the credentialing for medical providers, which is one of the reasons pharmacies are excluded from this bill. It makes no sense to pass a bill to say you can't credential pharmacies. Insurance companies would be opposed to that because we need them in our networks. And in order to write insurance in Wyoming, the Mountain Health Co-op at least has to be accredited by a national accrediting agency. And that agency says we must credential every single thing in our networks. So it makes no sense at all to exclude pharmacies from credentialing. And this bill doesn't do that. This is a process bill. It says you get it done in 60 days and you use a form that's going to be created and agreed to by the insurance commissioner. Including pharmacists in this bill opens up a whole bunch of other issues that the PBMs would need to negotiate. So we've worked hard to come to a bill to solve a problem that your medical community has. I am urging this committee to accept it as written and solve that problem. And if we need to come and discuss things with pharmacists, we certainly are always willing to do that. But in my opinion, it would be best brought as a separate bill at a later date. And you should pass this bill as a committee bill so that all the hard work that was done in the interim can be rewarded and we can solve this problem for those providers.
Okay. Go ahead, Representative Trujillo.
Thank you, Mr. Chair. In all this hard work that the task force went through and did all these investigations and talking, did it ever occur to ask the opinion of the one group that you're excluding, how it would affect them?
If you know, Mr. Spencer.
Yeah, Mr. Chairman, Senator, early on, I think at one of the committee meetings, PCMA was involved. But then when we went to the working group, it was pared down to simply providers and insurance companies. PCMA was not invited as part of the working group, and PCMA is the PBM trade association. So pharmacy very early on simply wasn't an issue with the working group, and we didn't have their expertise, and we didn't seek out the expertise of others on that issue because we all felt early on we were dealing with medical providers.
Okay. Representative Ahern? Nope. Senator Barlow? Go ahead.
Thank you, Mr. Chairman. So I'm interested in the comment that was just made, and the current language is pharmacies and pharmacists, but what was just referenced to was, I guess it's maybe a different entity of PBM. So is there a way to actually remove the pharmacist language, which was, I think, Chairman Baldwin's question, if one or both of those or one of those could be removed, and actually put in what the real concern is, and that seems to be with an organizational type, not on the other end, not a healthcare provider. Thank you, Mr. Chairman.
Go ahead, Mr. Spencer.
Mr. Chair, Senator, I responded to a question Senator Baldwin had similarly and pointed out that there are provisions in this bill that if we include pharmacists and pharmacies that then have an internal conflict, and that was just off the top of my head. I also know that PBMs, and those are the ones that the pharmacists and pharmacies are going to be contracting with, and then the health plans contract with the PBM, that they have concerns with how this bill operates if indeed it applies to pharmacies and pharmacists. And we didn't work through those concerns because early on we said, fine, we're not going to deal with those issues. And we did that very easily by simply excluding pharmacies and pharmacists from the definition of provider in this section. That's it, just this section. And so, yes, if you just include them, that opens up a Pandora's box. And there are a lot of issues that are going to come to the table that we haven't worked through and that would need to be worked through.
Okay. Go ahead, follow up.
Thank you, Mr. Chairman. So I guess my inquiry is the insurance agency and the insurance commissioner in the room? I have a question when it comes to the definition of, there's another definition that's being referred to in the bill, and that has to do with the health carrier. And what I want to understand from the commissioner, whether PBMs and some of these things are actually under the jurisdiction of the commissioner. And that language is included in the staff comment on the bottom of page 3, top of page 4. So if there is, anyway, I just want to ensure to myself, my own understanding that definition includes PBMs, et cetera. Thank you, Mr. Chairman.
Thank you. Welcome, Commissioner. Ms. Renking, if you'd introduce yourselves and take that question.
Mr. Chairman, committee members, Jeff Ruth, Department of Insurance Commissioner, and Jill Renke, who is with and involved in these discussions throughout. And I am gleefully going to pass the question on to her.
Jill Reinking, thank you. As the Commissioner said, I'm Jill Reinking, Senior Health Policy Analyst for the Department of Insurance. I did participate in these meetings regarding this bill. I believe if what we're looking at is the health carrier as far as how we enforce them or how we may overlook those health carriers. Within this bill, I think it does come back still to the discussion that has been made by the others up here, that when we were looking at this bill, we took it as it was specific to what was going on within this bill itself. So with regard to the pharmacy and pharmacists, we would not essentially be overlooking or guiding them through this bill. Also, with regard to what we would be doing within this bill, again, it was stated that we would be responsible for coming up with that application for everyone to complete as far as the credentialing. We would be meeting with those individuals, each of the industries, to discuss what they needed in their bills or what they needed in their application, compare what was the same, compare what was different, and come to an agreement on that. I don't know if that's essentially what you were looking for, or I can clarify beyond that.
Senator Barlow, did that help cover your question?
Mr. Chairman, I guess very specifically, are PBMs included in the definition of healthcare carrier? Looking at the definition of healthcare, it's on page bottom of 3-4. Do they perform the duties or those things? I'm assuming they do, but I want to know that from someone who's going to be responsible for implementing this law. Thank you, Mr. Chairman.
Thank you.
Mr. Chairman, if I can grab a statute real quick.
Sure. When in doubt, always refer to statute. I appreciate that. Any other comments while you're up here, Ms. Renking? Oh, we have you. How's the PBM? Do we have?
We have an individual that was hired. She started this week.
Excellent.
For the PBM position. So we're working on the processes as far as filing of complaints. We have been receiving them in the meantime and processing as we receive them, but hopefully now we'll get a standard process going and get her up to speed and be able to take more of those complaints on.
Off the top of your head, how many complaints are we getting roughly?
Since Chairman, since 2017, we have received 18 complaints. I did receive 2 in the last couple weeks. So hopefully we did some outreach to the Board of Pharmacy and had them put some information in their newsletter with regard to where they could go to file complaints and how to go through that process. So we're hoping that maybe the word gets out to more pharmacists that we're available to help them with those concerns.
Appreciate that. Thank you for letting me stall on a tangent. Mr. Commissioner.
Mr. Chairman, Senator, looking at the definition that's references here, 303A3, it does appear that PBMs would be considered under this definition and would give us authority. We do license PBMs. We also license insurers, so that's ultimately where we have the authority over them. Just one thing I'll throw out for the committee's consideration. With these talks going on, we have looked at other states that have done this, and they have come up with a uniform form, and we will look to that, but in none of those forms do they include pharmacies or pharmacists. I just throw that out there, do with it what you will.
How many states are we talking? 4, 5, 10? Any idea?
I have looked at 4 states
And they all exclude pharmacies and pharmacists.
in the ones that I've looked at, and I could get that list if the committee would like.
Probably wouldn't hurt to have it ready for session if the bill passes. Other questions while I have the Department of Insurance up? Welcome, Representative Trujillo.
Thank you, Mr. Chair. They exclude them on the application, but do you know if they're excluded in the bills in those states?
Mr. Chairman, Representative, that's our understanding.
Perhaps we could put some clarifying language in this bill that would affect other statutes and just, I guess, delineate that they're still, for purposes of this section, not required to go through this onerous credentialing process, but that we still, from what I understood from Ms. Carroll, some of the angst is that we're taking them out as healthcare providers and one part of our statutes, which, limits some, causes some issues. And I think if I ask LSO to start working on something right now, they could find a way to at least assuage some of the concern. But I don't know if you'd start figuring out how to maybe, I don't know, fix the definition in another part to ensure that we believe that they are providers, just not in this section. We'll work on that. Any other questions to the Department of Insurance? Seeing none. Thank you for coming up on short notice. Mr. Meyer, you joined us online. You want to present to the committee some? Floor can be yours.
Thank you, Mr. Chair, members of the committee. My name is Matt Meyer. I'm representing myself, my two pharmacies. We are one of the pharmacies that do contract both medically and through pharmacy services. And one of the things that we do run into quite often is again, I kind of disagree with some of the comments that excluding pharmacists from this definition would cause problems with the pharmacy credentialing, because again, when we're talking about contracting directly with healthcare carriers, that's all on the medical side. Now, some pharmacies don't contract for medical services, for medical supplies and equipment, but we do operate in both realms. And one of the things that we do run into that's very difficult is getting recognized to be able to bill for those services. And by excluding pharmacists and pharmacies, you're basically could potentially be saying that again, these services aren't required to be provided by healthcare carriers or pharmacies or through pharmacies, which again, just in Sheridan, in one of our pharmacies would exclude 32 of our addiction patients that we treat every month. So it is a real problem. It is a real concern that putting something in legislation in the insurance code that states specifically under the medical contracting side that pharmacies or pharmacists aren't considered, healthcare providers and aren't under this contracting protection, or the any willing provider clause for that matter, if we include that definition in this language in the insurance code, that we would be able to continue to offer those services. So with that, I mean, again, I would stand for questions at this point.
That's a concern. Senator Barlow, go ahead.
Thank you, Mr. Chairman. So is there some Mr. Chairman, if I could, is there some language that someone would suggest that actually ferrets that out a little bit and talks about that component, that we don't exclude pharmacy and pharmacists, but we say pharmacy and pharmacists are included for this specific purpose, for what Mr. Meyer is trying to get to. And like I said, there's some nuance in what you're talking about that I don't understand completely. But can you actually put it into some short language that says for these purposes, they are healthcare providers, instead of going the other way and saying they're not? Thank you, Mr. Chairman.
And if that's a question to us, I think both two LSO attorneys and another attorney who just approached the desk are all working on potential amendments. But for that, let me make sure there's any other questions for Mr. Meyer while we have him. Seeing none. Thanks for joining us remotely from Sheridan, Matt. Mr. Spencer, I guess we'll have a go with you before LSO.
Sure, Mr. Chairman.
And again, we haven't moved the bill, so this is.
I understand.
Yep.
Conceptual. My understanding is the concern from the pharmacists is that their exclusion from this process bill will have effects on other statutes, right? And other things that they do in the healthcare community. And a very simple and elegant solution to that is in the definitional section where it says pharmacies and pharmacists are excluded from healthcare provider, right at the very beginning, you simply say, for the purposes of this section only, okay? And then you have the definition. That way, it's clearly limited to this process bill and doesn't expand out to any other Wyoming code. You know, if there are concerns from the pharmacists and pharmacies about the credentialing process, that certainly can be resolved in another bill. This bill was trying to resolve the concerns of medical providers, and sometimes you can't resolve everybody's concern in one bill. But that's a suggestion that I think is an elegant suggestion. It's very easy, and it's very targeted, and it clearly says that that definition doesn't expand out into other parts of Wyoming code.
Thank you for those thoughts, and we'll incorporate them at the appropriate time. Any other public comment? More and more people are joining the room, but probably not for this topic, but I just thought I'd ask one more time. And no one else online that I'm seeing. With that, before I ask for a motion on the bill, I'm gonna check with Anna real fast. How much on the fly can I get an amendment together? Do you want us to take a 10 or 15-minute break now? Certainly can.
Mr. Chairman, I think it would probably work to just have an amendment to that specific healthcare provider definition where it says pharmacies and pharmacists are excluded for purposes of this new chapter 56, but are still required to go through the credentialing process otherwise, or something along those lines. I think that would probably work. I don't necessarily even know that that language is necessary, but I think just for the sake of clarity, it might be beneficial to have that in there.
I completely agree. My question is, how long is it gonna take to write something good?
Do you want me to write it? It won't take very
I
long.
guess we're gonna put in statute and hopefully move a bill and pass it today, so
I
if
could
you
do
need
it.
10 minutes, we'll take a break. If you think you can come up with it
I think I could come up
in
with
about
it.
45 seconds. Okay.
Sure.
You keep working. Any other public comment one more time as I'm quickly stalling? Yep, Representative Trujillo, thoughts?
Excuse me, Mr. Chair, but I think it's a waste of time until we actually bill and discuss anything to have our LSO write anything up.
You mean until we move the bill?
Yeah, I don't feel that we've fully discussed this as a panel to even have our people work on something yet.
Happy to take more public comment, and if not, we'll move the bill and we can discuss. Representative Ward.
Thank you, Mr. Chairman. Rep. Hutchings did have her hand up just a second ago, and now she doesn't. I'm not sure if she wanted to say something.
Senator Hutchins, jump on in.
Thank you, Mr. Chair. I too was a little concerned, and thank you, Representative Ward, about on the fly. My suggestion, it'll come during our discussion, but it seems like we're doing a lot of, let's get this done, let's get it done, let's get it done, instead of really thinking out why this may be a major concern for a particular portion of our industry here in Wyoming, our professional industry, and we don't want to mess things up. Preview, if we pull this section out, the group has 4 months to hash out what kind of language they think should be there for next session. So that's just my little thought for right now. Thank you, Mr. Chair.
Yeah, thank you. I mean, I know we've had 4 months. This is the third time we've seen this issue. You've had 2 committee meetings, if not 2 select working group meetings, if not more, 3. So I'm happy to continue to the discussion. I know there can be amendments to the bill. Either way, my question generally was if we need to take a break and come up with something short and elegant, but if we think we're ready, I'd take a motion on the bill and we can see where we go. So with that, anybody want the floor to make a motion on this bill? Senator Baldwin, go ahead.
I would motion to move the bill, please.
Seconded by Representative Chadwick. All right, committee, discussion on the bill among the committee.
Mr. Chair.
Let me go with Representative Yin and we'll go to Senator Hutchins.
Okay.
Mr. Chairman, thank you. I think it's a good thing. The bill is a good bill. I hope we turn it into law. I am unconvinced with, I understand the concerns over PBMs, and I think we should actually make sure that if we change the healthcare provider language, we should not involve PBMs. I think contractual agreements between pharmacists, pharmacies and PBMs should not belong in this bill. I am, however, unconvinced that pharmacists are different when it comes to providing some services that they provide in contract with health insurers for. So I do think that they should be involved in this bill, whether we make an amendment now or we make an amendment later after they consult within the 4 intervening months between now and session. I think doesn't matter that much, but I'm of the preference to force the issue a little bit and have them amended in now. I think I will make an amendment, but if Senator Hutchings wanted to be that voice to make the amendment, she's more than welcome to, but my amendment will likely be different than hers.
Let's hear it. Let's hear it.
Okay, so I move that we strike lines 13 and 14, and then on line 17, we insert language, and I'll go slowly, and shall not include pharmacy benefit managers as defined in 2652-102A, Romanet 7. And that's my amendment. If there's a second.
Oh, is there a second? Let's start there. Seconded by Ward. All right.
No, I have a comment. I don't understand what you're saying enough to
How
second
about let's
your
repeat the
amendment.
motion real quick, Representative Young.
So, Mr. Chairman, my motion again is to strike lines 13 and 14. So we remove pharmacies and pharmacists from the shall not mean. So we strike that definition, so it's the default definition of healthcare provider. And then on line 17, we explicitly exclude pharmacy benefit managers from the definition of health carrier. So we're not, the credentialing process here will not involve health PBMs, but still will apply to the insurers directly credentialing pharmacies and pharmacists.
Mr. Chair, I am going to wholeheartedly second that amendment.
Excellent. All right, we have a motion on the floor. Anna, I know you raised your hand. Is that language workable?
Mr. Chairman, I think that would work.
Mr. Chairman, can we get that statute reference one more time?
Third time's a charm, Representative Yin.
Mr. Chairman, and shall not include pharmacy benefit managers as defined in 2652-102A, Romanet 7.
And so this would be a new subsection 6 at this point. You're not adding it to
No.
the definition, you're adding it to the definition of health carrier.
Correct.
Means all of these, but a health carrier doesn't mean a PBM.
Correct.
Right.
Be scanning the audience to see any weird looks. Everybody's kind of staring at me back, so.
Mr. Chair, I think that is a good solution, and I'm happy that Representative Yin took the time to do that. The PBMs were not an issue at all in this bill. For me, it was more on what the pharmacists do outside of what they do with the PBM. So I'm thinking this is going to help that tremendously. And if in the next 4 months, the people that worked on this bill, oh man, that's just not going to work, or oh man, that's, let's bring it back during session. But to get this bill forward, in my eyes, I think this is the right thing to do. Thank you, Mr. Chair.
Okay, with that, all in favor of the motion, signify by saying aye. Opposed, say no. That motion is carried. Any other discussion or amendments on the bill in front of us? Representative Hornock.
Thank you, Mr. Chairman. I would like to make a motion to actually remove Section 3 and the references pertaining to Section 3.
Give me a
Throughout the
page
bill.
number for people watching at home.
Page 7 as Section 3, and then I know the very last paragraph of the bill refers to Section 3 as well. I'm not sure if there are any other places in the bill that refer to Section 3.
Okay. So committee, that deletes, just for those of you who don't have the bill in front of you, that the Department of Insurance shall promulgate the rules providing for uniform credentialing applications to be used by applicants and health carriers. And so this would allow, I assume, each insurance carrier to have their own form or do the process they wish to do to credential, kind of like we do now. Is there a second?
Second.
Seconded by Representative Ward. Discussion.
Can Representative Hornock clarify his desires a little bit further? Thank you.
Let's hear your desires, Representative Hornock.
Thank you, Mr. Chairman. So it seems to me like the major issue that we want to solve with this is a timeline issue. And so by removing section 3, we actually leave the applications, the application standards, everything within the insurance agencies themselves. They set up the applications, they set up the credentialing, but they're held then to a specific timeline for this. We then are taking it out of the Department of Insurance to make the rules to, yes, we won't have a standardized credentialing form, but we also won't have a Department of Insurance that that kind of, it's a government agency that I think otherwise we would leave it to the private sector to create their own application, their own standards, things like that. So it seems to me like they have that already. They have the applications already. They have done things specifically for their industry, for their insurance coverage, for their insurance carriers. They would be able to then to maintain their specific applications. It's just now that they would be held to a certain timeline for approval, which is the problem we're trying to solve with this. So that's kind of my that's my motion and an explanation. I'd be happy to answer any other questions.
I think you'll make your insurance companies happier. They can prescribe their own forms. You'll make your provider community less happy that they have to do it differently for each company. So, I mean, an interesting sentiment. Representative Clouston, thoughts?
Yeah, thank you, Mr. Chairman, and I appreciate the sentiment. But again, the timeline part would be fixed, but all the work that we spend doing different forms for every single insurance company, that problem would not be fixed. So I appreciate where you're coming from. As a provider, though, it's a lot more work. And when you take that for every provider across the state, that's a lot of time that's spent, a lot of money that's spent by these organizations filling out the forms for every single insurance company. So it's a cost savings measure for our providers, leaving that in there.
Other discussion, Representative Hornock.
Thank you, Mr. Chairman. It seems to me like this, the way that I approach this, if I am looking for a job, I have to go to every single individual company and fill out an application, the application that they establish for their particular company. And it can be tedious and it can be arduous. And I've been in that position before. Even as a business, when you respond to an RFP, there is no standard RFP form that I have to fill out. I can't just create a PDF document and email it to everybody I'm trying to get work from. So I understand it can be tedious, but I just think that this adds some protections to the insurance companies, and it kind of keeps, I know it would be nice to standardize everything and to have everything where you just click send on an email, drop an attached PDF onto something and click send to everybody. But I just don't think in a healthcare industry that is so varied and takes care of so many different things, I still think I would like to see those protections in place that protect the industries themselves on each individual application. So, this bill solves the timing thing, which is really the issue. Yes, providers and doctors and things will have have to still go through a tedious process to determine, it's like continuing to build your resume. That's just part of the game you play when you're in business, when you're working, when you're trying to get jobs. I mean, I don't think we should take that away, really.
Senator Barlow, thoughts?
Thank you, Mr. Chairman. So on the removal of this, and I certainly also understand the sentiment, but does it alter the enforcement mechanism that the accountability that the department would then have if and a carrier was not doing things within the timeline? So if we have a standardized form, we have a agency that is responsible for that. Because if we take that out, then are we just left with civil recourse if somebody doesn't do the 7/30/30 type of thing? Or does, with this bill, with the inclusion of the insurance department, does this specifically give them some authority to weigh in with these and maybe even fine or whatever the penalty might be with a company who is not following through with the requirements of this, the timing requirements? So and maybe this is for the insurance commissioner to come back up, but if we take them out of this completely, and it's still in their section of statute, have we also limited their ability for enforcement, for oversight? Thank you, Mr. Chairman. And it's a question. I don't know the answer. It's a question. Thank you, Mr. Chairman.
Thank you. We can think about that question, and Insurance Commission, if you want to come back up, you're welcome to. Welcome back.
Thank you, Mr. Chairman. Jeff Roots, Department of Insurance Commissioner. At the very beginning of our statute, under 26.1.108, it talks about our jurisdiction. And it basically says any violations of this statute, there are certain penalties, unless specified elsewhere in different acts. So that would be the default. So we would have authority over this matter if, for example, an insurer routinely disregarded the timeframes. We could take action. It would, we don't have the authority to make them contract. We have the authority to fine them or suspend a license.
Okay, President Ward.
Thank you, Mr. Chairman. Philosophically, I am uncomfortable with any language in bills that says such and such agency shall promulgate rules. That furthers the administrative state, and rulemaking and lawmaking belong with the legislature, not the administrative state, is why I seconded this amendment, and I wholeheartedly support removing Section 3 and the reference to Section 3 at the end of this proposed bill. And that is philosophically the reason. I agree with Representative Hornock that the private industry can come up with their own applications and should. I don't think that the government should tell industry what the application should look like.
Okay, I don't think that was a question for you, Commissioner. Any other live? Okay, thank you. Other discussion on the amendment? Representative Penn.
Thank you, Mr. Chairman. I support this amendment as well, removing Section 3. As Representative Hornock has brought up, this does create a creep of government. Sure, it would be great to have the convenience of a standardized form, as was, Representative Hornock gave the example of various job applications. Earlier, we heard, the idea of med school applications, grad school applications. It's different everywhere you go, and it's a pain in the hiney. But if we go to government every time we have a pain in the hiney, then we have big government, and that is not something that I'm interested in doing. Being a healthcare provider myself, I understand the difficulty and the time that it takes to do all these things. But as a representative of the people and a steward of keeping government within its proper constraints, I think that this is a good move.
Other discussion on the amendment? Seeing none, and someone calling the question, all in favor of Representative Hornock's amendment, please say aye.
Aye.
Opposed, say no. No. Show of hands, all in favor of the amendment, raise your hand. 1, 2, 3, 4, 5. All opposed, raise your hand. 1, 2, 3, 4, 5, 6. Okay, that amendment doesn't pass. Any other amendments or discussion on the bill, committee? Seeing none, and question being called by Senator Baldwin. The motion on this is to make it a committee bill for the 2025 session. Ms. Talbot, if you'd call the roll.
Mr. Chairman, this is roll call for 25 LSO 0032, provider enrollment standards as amended. Senator Barlow,
Aye.
Senator Bouchard, Senator Dockstetter, Senator Hutchings, Senator Hutchings,
You're muted.
Sorry about that. I'm gonna be an aye.
Representative Chadwick, Representative Clouston,
Aye.
Representative Hornock,
No.
Representative O'Hearn,
Aye.
Representative Penn,
No.
Representative Trujillo,
No.
Representative Ward,
No.
Representative Yin,
Aye.
Co-Chairman Baldwin, Chairman Zwanzer,
Ma'am, ma'am,
Senator Hutchings, go ahead.
I'm gonna go aye to no.
Okay. Any other changes? With that, Ms. Talbot.
7 ayes, 5 no, 2 excused.
Okay, 7-5. With that, committee, let's take a, I'll say 10-minute break, but that'll make it probably 15. But let's try to come back at 10:20. Thanks. All right, welcome back from the break. Next up will be 25 LSO Working Draft 136, number 5, a joint resolution to amend the Constitution on limitations for damages for personal injury or death, commonly known as tort reform. Lucas, if you'd walk us through the proposed constitutional amendment.
Absolutely, Mr. Chairman. Luke Plum, LSO, here to discuss 25 LSO 136, limitations on damages for personal injury or death. This is a constitutional resolution. It would amend the Article 10, Section 4 of the Constitution, and this is the section where the general rule is that there shall be no law enacted limiting the amount of damages to be recovered for causing the injury or death of any person. What this amendment to the Constitution would do is so that's subsection A is the general rule, and subsection B, it provides that, any section of the Constitution to the contrary notwithstanding, for any civil action where a person alleges that a healthcare provider's act or omission in the provision of healthcare resulted in death or injury, the legislature may, by general law, and this creates a new paragraph 2 and 3. The first one is, the legislature can mandate alternative dispute resolution. And so what this one does is it adds in that the legislature could limit the amount of damages to be recovered for a healthcare provider from a healthcare provider for non-economic loss resulting from the death or injury. And so non-economic loss is generally damages for things like pain and suffering, loss of capacity of enjoyment of life, loss of consortium, et cetera, those kind of things, general damages. But then it also provides that no law shall be enacted limiting the amount to be recovered for economic loss or exemplary or punitive damages. Economic loss are the actual costs related to the death or injury, such as medical expenses, loss of wages, those types of things. And then exemplary or punitive damages are damages to punish or deter, essentially just to try and stop further behavior of that type. This amendment would also repeal subsection C, and that is just to kind of maintain the new policy that this amendment would do for setting, that the legislature may set limits on the recovery of damages in certain medical malpractice cases against healthcare providers. Section 2 of the resolution begins on page 3, and this is just the statement that the Secretary of State would endorse for to be placed on the ballot. It essentially just goes through, as I've discussed, that this would allow the legislature to enact laws to limit non-economic damages and provides what that means. It provides that this amendment will not affect the recovery of damages for economic loss and provides examples of that. And it also mentions that this amendment expressly does not impact the recovery of any additional damages known as exemplary or punitive. I made a staff comment on page 4. This resolution was modeled after House Enrolled Joint Resolution number 1 that was brought during the 2004 special session, and also kind of was modeled after Texas 2003 resolution that did the same thing to establish limits on the recovery of damages. One notable difference I just wanted to highlight here is that in Texas resolution, they allow the legislature the authority to limit the amount of all other types of damages and losses that are not economic or non-economic in nature. So these are just, they're slightly different. If the committee wishes to consider including allowing the legislature to set limits on exemplary or punitive damages, that certainly could be changed. And then there's just one further paragraph discussing the removal of Section 4C, and then on page 5, I've provided that language that would be repealed. And just wanted to note that there's not an effective date. This is a resolution. If it were to pass the committee and subsequently be adopted by both houses, then this would be placed on the 2026 general election ballot. With that, I'd stand for any questions.
Questions for Mr. Plum? Seeing none, I have one. I've never seen a 5-paragraph statement on the ballot before. Is that similar to what was used in, 2005 on the ballot? That's something that lengthy?
Mr. Chairman, yes, it was 4 paragraphs. I added the one additional paragraph about the repeal of subsection C.
Well, shoot, no wonder it failed. That's a lot of reading on a ballot at the end. Other questions, committee? Senator Barlow, go ahead.
Thank you, Mr. Chairman. So I just want to be clear about the repealer. The repealer is basically eliminating workers' comp, the mandatory workers' comp we have in the state of Wyoming. Is that for extra hazardous duties. Is that accurate? Or removing the constitutional requirement of it? Is that accurate? Thank you, Mr. Chairman. And then the second, I guess I'll just do two questions. Is those definitions, exemplary and all that stuff that's included in the verbiage that would go on the resolution on the ballot, are those standard? I mean, are those elsewhere in current statute? Are they just a matter of law? Is this a Black's Dictionary type thing? Those economic, non-economic, exemplary, et cetera. I just want to understand what the common understanding of those definitions is. A common understanding that's what those things mean. Thank you, Mr. Chairman.
Mr. Plum, both of those.
Thank you, Mr. Chairman. Senator Barlow, yes, you are correct. The removing subsection C does address workers' compensation. That is in Title 27 of Wyoming statute currently. It just was suggested, to remove that for maintaining the tort reform, that this would be within, trying to create new sections in the Constitution just to address medical malpractice liability. And then as to your question of exemplary damages, that term, exemplary damages, punitive damages, is used in statute, not incredibly frequently. There's just a few places. It's primarily found in like the Code of Civil Procedure, and then a few other places in statute, but it is generally more of a, that's more of like a common law kind of thing. Black's Law Dictionary type of definition for those types of damages that are common in these sorts of cases.
Okay, thanks. All right, any questions for LSO committee? See Representative Penn.
Thank you, Mr. Chairman. Just so I can wrap my brain around this, would you be able to give any examples of punitive damages in a circumstance such as this? Is this like removal of license, or what are we talking here?
Mr. Plum, if you know. Otherwise, certainly other people in the room will jump at that one. Go ahead.
Mr. Chairman, Representative Penn. I don't know. I can't speak specifically to if it would be removal of licenses. Often, like like punitive damages it's an additional monetary award for if the conduct was egregious and stuff. But someone else may be able to provide more context for that.
Other questions? Seeing none, I guess we'll have some public comment. Who wants to go first? I do love this game. I can start in the left and go to the right, start in the right. I can start with agencies, since you guys are up in the front row. Mr. Wolf, Ms. Kagan. Mr. Wolf, congrats on your recent promotion, or condolences, one of the two, but we're certainly happy to have you today. If you'd introduce yourself and as well as the director. Go ahead.
Thank you, Mr. Chairman. Jason Wolf, Deputy Director for the Department of Workforce Services.
And I'm Liz Gagan, the Director of Department of Workforce Services.
Mr. Chairman, so just wanted to let the committee know, we've reviewed this proposal with our Attorney General representatives, and I guess just a couple of comments here is on the repealer of Section 4C. I guess first, we're unsure how that gets the committee to the catch title on the limitation of damages for personal injury or death. I guess second of all, just some things to be aware of should 4C go through a repealer is, again, in consultation with our legal representatives. As Mr. Plum said, there is a statutory construct out there that already sets up workers' compensation. However, we do feel that repealing Section 4C could weaken that statutory construct. In particular, weaken it with what we call the exclusive remedy. So at current in statute, and because of the Constitution, the way it's written in 4C, when an employer is an extra hazardous employer, as outlined in 4C, they are required to purchase workers' comp coverage through the state fund. And when they do so, they are given what's called immunity, meaning that when they have an employee injured, workers' comp is the exclusive remedy. They cannot sue their employer for damages. So we feel that could be weakened with the repeal of 4C. And then also just probably one of the most important things in 4C is that it does line out towards the middle of Section C Monies in the fund shall be expended only for compensation authorized by this section. I would just note for the committee and the LSO folks, that is not in statute. The statutory construct for workers' compensation has no protections for the fund. So if 4C is removed, there is potential for the workers' comp fund, which is currently protected by that piece of constitution, could be subject to expenditures that it's not ready for. And by that, I mean, without 4C, it's conceivable that, you know, a legislative action could take money from the workers' comp fund and pay something other than workers' comp costs or to administrate the act. So with there, I'll pause, Mr. Chairman, and see if there's any questions.
So regardless, we would have to put in something in statute. If 4C comes out of the Constitution, this would likely need a companion bill just to have something in statute on, I mean, how workers' comp exists. It could be similar to what's in the Constitution, but do we have anything that basically, I guess, is the same 2 paragraphs in our statutes now where we would need some type of companion bill in the next 2 years if this were to pass to kind of specify the parameters of workers' comp? And then it's only in statute, so the fund would be, I guess, subject to appropriation if it's not constitutionally protected. But is that how you're reading of it as well? We would need something to develop, but this goes through to at least specify how the workers' comp system works with the current parameters in statute.
Mr. Chairman, yeah, I think that's pretty accurate. Currently, like I said, in statute, there is, you know, statutory verbiage already that dictates what an extra hazardous employment is. In statute, it already allows for optional employers that aren't extra hazardous to opt into the system. There is already statutory construct for employer immunity. And again, kind of the most important part of 4C being repealed would be some kind of statutory protection for the fund to only be used to administrate the costs of the act.
Other questions, committee? Seeing none at this time, Ms. Director, anything else to add? While we have you, it's a rarity.
Mr. Chair.
Oh, Senator Hutchins does have a question. Go ahead.
Thank you, Mr. Chair. Sorry again for interrupting you. I'm a little concerned, first of all, about amending our Constitution. And maybe you can give me a little background. I had to jump up briefly, and I may have missed it, where this request came from. And if I have it right, Section 10, with it, an employee, if they take workman's compensation for an injury, cannot sue. And if we remove this, then they can take workman's compensation, possibly exhausting workman's compensation, and because they can now sue. Is that what I'm seeing in this, sir?
Let me deflect that to Anna. Just some refresher for the committee. This was a motion at our last meeting to have this on the agenda to talk about tort reform. But perhaps I could ask Luke, do we have to take out 4C from the Constitution, or could we really just do the amendment in B to put in the new Romanettes 2 and 3, or did the conflict having it remain in there with the new subsection?
Mr. Chairman, you know, it is repealed. It was just kind of a thought that within the, you know, policy preference here for tort reform, that it might maintain, you know, just like help to clarify, you know, that specific thing for actual tort reform and limiting damages. This section does deal with workman's comp. I did try to note that, you know, for this section is being repealed, but it could be for the committee's consideration whether you'd like to have this removed in order to meet those policy preferences for medical malpractice that are expressed in this joint resolution. But I think, yeah, it's really up to the committee.
But I guess my overall question is, it is divisible. If we didn't want to touch 4C, we could still amend in, Romanet 2 and 3 and B and not have a constitutional conflict if we didn't want to go all the way. In your opinion?
Mr. Chairman, I think certainly, 4C does more so discuss, that, any contract or agreement with an employee waiving the right to recover damages for the injuries shall be void, and then more specifically does get into the portions of the fund for workman's compensation. I think that they can be divided. And yeah, it's just up to the committee on the policy preference.
And then, I don't know if from Senator Hutchins' question, I think I covered it, but if not, Mr. Wolf, go ahead.
Yeah, Mr. Chairman, if, I think her question, hopefully this is an answer. Her question was, could they, then, if this was repealed, could an injured party then exhaust their workers' compensation and sue their employer? I don't think that's likely because of the current statutes that are in place. I just think from our discussion with our legal experts, there could be more of an argument to weaken some of those statutory constructs that exist, so.
We would have a couple of years to make sure we ensured our statutes were tight before the constitutional amendment passed, I'm sure. Okay. Other questions for the department? Representative Hornock.
Thank you, Mr. Chairman. So on that point, though, if we remove section 4C, there are still parameters within Wyoming statute, though, that designate what happens with workman's comp funds and things like that. So we still have, wouldn't we then still have those parameters in place through statute, not necessarily through Constitution?
Mr. Chairman,
Yeah, Mr.
Representative Hornock, in part. So there is statutory language in 2714-701 that allows for us to pay benefits out of the workers' comp fund. The one thing it does lack in that statutory section, however, is what the Constitution says is that that's the only thing that money can be used for. So if that's not in there, again, it's conceivable that some legislative action could take money from that. And what that would ultimately cause is a lack of our ability to pay our liabilities. We set rates based on how much liability we have out there. We collect money to pay those liabilities. So if money's rated from that fund, we could be in a position where we wouldn't have enough money in the workers' comp fund to pay our existing liabilities.
Which we would hope never happens, but those of us who've been around a while, when we raided all the water funds that we said would never happen, when times get tough, people do weird things. Other questions for the department? Seeing none, thank you much for being here today. The nice thing about being in Cheyenne, we get all the agency top people. Other public comment, or again, who wants to go next, or I can call on people. Any other agencies here? Department of Insurance, doesn't affect you necessarily. Not seeing any other agencies besides YDOT, but I don't think you're here about tour reform. All right, any of the people with law degrees in the back of the room? There's about 7 of you. Seeing none of you, come on down. We have 4 seats. Welcome, Ms. Shaner, Mr. Ronowitz. Floor is yours, whoever wants to go first, as long as you announce yourself.
Good morning, Mr. Chairman. Good morning, Mr. Co-Chairman. Good morning, all of the committee. I want to take 1 minute and just thank our 2 chairmen for their years of legislative service and your leadership. Made big contributions, and I personally am going to miss you both very much. So thank you very much for all that you have given to the state of Wyoming. And I know there are a number of other committee members who won't be returning, and I want to say thank you to you as well. And we appreciate your time this morning. This legislation was brought during your discussion of increasing the number of
Ms. Shaner, I'm not sure you ever announced yourself
myself
and who you represent.
Or I was going to introduce Mark too, which is my whole job.
Oh, yep. But we appreciate the nice comments, I think.
Yes, well, I am Marcia Shaner with the Wyoming Trial Lawyers Association, and with me is Mark Aronowitz, who is the Secretary Treasurer of WTLA and also the Executive Director of Lawyers and Advocates for Wyoming. And he will make most of our comments. I just wanted to provide a little bit of history since I've been around for a really long time. Longer than some of you have been alive, I think, and we've talked about this issue numerous times. I think this bill was brought in response to the goal of the committee that was stated during your last meeting to increase the number or the maternity care in the state of Wyoming for our families and moms and new babies. And we strongly support that goal. We're happy to work with this committee on solutions that will help you reach that goal. However, we don't think that this bill is one of those solutions. As I mentioned, I've been with WTLA over 30 years. We have talked about capping damages, all kinds of damages during many, many years. We've looked at this as a solution for a number of issues that healthcare providers have faced. And as we found then, and what is still true today, is that capping damages doesn't lower medical malpractice premiums. It doesn't encourage docs to move to our state, and it won't solve the problem of maternity deserts in Wyoming. We spent years looking at caps. We looked at numerous versions of the bill in front of you. It was rejected many, many times and eventually was passed and went to the ballot in 2004. And we asked the people of Wyoming whether they wanted government to decide the outcome of their cases or whether they wanted to trust Wyoming juries to determine the outcome of their cases. And our folks said no. They wanted Wyoming juries to determine the outcome of any case that they might bring. So hopefully we can use that experience and some of the data that Mr. Aronowitz will provide you to look at real solutions rather than taking up what will be a lot of time and a lot of controversy probably talking about this issue, and we can look at things that will really work. And I will turn over the rest of our time to Mark.
Go ahead.
Good morning, Mr. Chairman and members of the committee. My name's Mark Aronowitz. I am on the board of the Wyoming Trial Lawyers, and then I run a not-for-profit law firm as well. If the goal of this legislation is to attract and recruit and retain specialty physicians to rural areas of Wyoming, we're totally in support of that goal. In the last session, we supported the same thing with providing attorney services in rural counties that just don't have that. So we want to be consistent in our messaging if that's the goal. But our honest opinion is there's no way that this type of legislation is going to help us achieve that goal in any way. So I'll start with some statistics that will show that a little bit. We've provided a map of every county in the country, and there's no relationship between this type of legislation and where maternity care deserts are. States without this legislation have counties with access to maternity care. States with this legislation still have maternity care deserts, very often in rural areas, but there's no connection between this type of legislation and where specialty physicians are practicing. The number of active physicians in Wyoming has increased from 1,149 in 2014 to 1,265 in 2022. So it is at least trending in the right direction. At the same time, and this is an important graph in that handout, medical malpractice payments in Wyoming have been steadily decreasing for 22 years and are currently near the lowest point they've ever been. You can see on that chart in 2002, it was pretty high before the last time this was on the ballot, but it is significantly lower now. Also, a significant percentage of medical professionals practicing in Wyoming already have their possible exposure capped by the Wyoming Governmental Claims Act for public hospitals and county hospitals. Malpractice rates for doctors in Wyoming are 5% lower than the country as a whole. And then the conclusion from Wyoming Department of Insurance 2023 malpractice claims against Wyoming healthcare providers was, there are a sufficient number of professional liability insurers servicing Wyoming healthcare providers. The market is competitive. Accordingly, there is no need for departmental or legislative action at this time. So that's some of the factual and statistical background to this issue. But we have some major problems with this type of legislation, and we'll just go over them with you. But first, there's an erosion of constitutional rights here, and it's taking away a right equally applicable to all Wyoming citizens in favor of a very select group of professionals. And I think we can all agree, at least I hope we can, that we all cherish our constitutional rights and our freedoms. Article 1, Section 18 is religious liberty. Our Section 23 is education. Section 24, the right to bear arms. Section 33, compensation for property taken. And then some new ones, Section 38, right of healthcare access. Section 39, opportunity to hunt and fish and trap. I've been around long enough to see ballot initiatives that are increasing constitutional rights. I can't recall one that's taking them away. So amending the Constitution to eradicate rights is very solemn business. The equality state is an extremely pro-life state. I think we all know that. This legislation devalues human life, and I'll tell you how. But the end result is you're literally putting a dollar value, a dollar figure on human life by creating two types of citizens. And pages 2 and 3 of what you have in front of you, the bill itself, talks about these two different classes. So the first class of citizen is your economic damages, economic value. This is lost wages, lost earning capacity. It's young people or working people with high wages or salaries. And then there's people that don't have that, babies, our children, stay-at-home mothers who don't earn a wage. I'm not saying they are without value at all, tremendous value, but not actually earning money, and the elderly or retired or disabled. Non-economic damages are pain and suffering, loss of enjoyment of life, just the joys of being alive, the love of a parent for a child. For babies and children and retired, their cases are only about non-economic damages and the loss of enjoyment of life. So we're creating two classes of people with this type of legislation. Also, frankly, this is governmental interference at the highest level. You don't need the legislature to put things on the ballot to tell juries what to do and tell judges what to do. Wyoming is one of the most conservative states in the country. Our juries are some of the most conservative juries in the country. And we don't need to tell our juries, we don't care about the facts. We don't care about the law. We don't care about the testimony. We don't care about the evidence. We don't care about your time, and we don't care about your deliberations. This is the number that we have decided, and that's how it's going to be. And thanks for your service, but we'll decide. You can trust Wyoming jurors because there are so few verdicts that go above the numbers that might be considered and put on. Like, it's just so extremely rare, which is how we know that this isn't going to solve the problem that you're trying to solve. We all know that from TV shows, probably the criminal standard for proving a case is beyond a reasonable doubt. That's the standard that you need to take somebody's freedom away. I would urge you to apply the same standard to this type of legislation. You are taking away the freedom of a constitutional right. If you choose to move forward, let's be sure beyond a reasonable doubt that this is going to achieve our goals. Like, if we do this, there will be more physicians. We're positive that this is what's going to attract people to rural areas. Like I said, I just don't think that's going to happen. I don't think anyone who follows us today is going to be able to tell you with certainty, you're going to achieve your goal if you just do this. So we know the phrase, this bill is a solution to a problem that doesn't exist. The problem is real, and we recognize that problem and commend you for wanting to solve it. It's just, this bill is not a real solution. It's not going to solve that problem. And then couple of closing thoughts, and I'm sorry I've taken this long already. In the past with ballot initiatives, I've always seen, or I think I've seen, an appropriation that needs to be part of the bill for the printing and the messaging and the notification. This lacks any kind of an appropriation. And then possibly the biggest issue of all is page 1, lines 12 to page 2, lines 2 through 4. And that's the Article 10, Section 4C. So everything I've said already is Article 10, Section 4A, taking away the constitutional rights that say we're not going to limit what juries decide to do. 10.4C by itself is like worthy of a special session, not an interim study, but that is the foundational bedrock of like the entire employer-employee relationship and the entire work comp system. And it's why Mr. Wolf, can say, well, yeah, the statutes some of the statutes are still there, but we're not so sure. But it's kind of shocking to me as someone who follows work comp and cares about that a lot, of that somehow 10.4A and 10.4C are both being considered in this single bill at like lightning speed. But again, each of these issues is a special session unto itself. We all know that phrase, this bill isn't ready for prime time. What's written and what you're considering today is not ready for anything. And it's definitely not ready for the dignity of being considered as a committee bill. So I think we're at an important fork in the road with this. We can spend the next 2 years and 3 months fighting this and all the messaging and ads and leading to a ballot initiative and spending hundreds of thousands of dollars on either side. I definitely don't want to do that or to be any part of that. But there's another fork where we continue to study this issue. How do we get great care, great physicians, more physicians to Wyoming citizens and rural areas? And I would urge you that that is the path that we need to take. And this bill is not going to help you get on that path at all. So changing the Constitution is not going to be a solution for us. And I'm happy to stand for questions and thank you for your time. This was much longer than I intended to be.
We're a heck of a lot of fun. Questions from Mr. Aronowitz, Representative Ward.
Thank you, Mr. Chairman. In your handout where you have graphs of active physicians in Wyoming, you have 2014 through 2022. Where's 2023 and 2024? Do you have information on that?
Mr. Aronowitz, if you know.
Mr. Chairman, Representative Zwanitzer, no, there's often a lag in getting this information. We've been scrambling the last couple of weeks, but whenever the state physician workforce data book updates, we'll have that information.
Senator Barlow, do you have a follow-up, Representative Ward? Let me get to Senator Barlow and I'll come back to Representative Penn. Senator Barlow.
Thank you, Mr. Chairman. And while not subject of the bill itself or the resolution before us, Mr. Aronowitz mentioned the Governmental Claims Act. So my inquiry is, and I am somewhat sympathetic to some of this discussion about this concern, but what I want to know is, do you think we actually ought to take a look at the Governmental Claims Act? Because that is in itself limiting to what people can have remedy for in some of these acts. And I don't believe that's been updated in nearly 50 years, that $1 million cap. So any comments on that? Thank you, Mr. Chairman.
Mr. Aronowitz, thoughts?
Mr. Chairman and Senator Barlow, yes, we definitely think that the limitations of the Wyoming Governmental Claims Act for healthcare or all of the other provisions of that act need to be looked at and are being looked at, I believe, by a different committee and a different study, but yes.
Okay, follow up? Nope. Representative Penn.
Thank you, Mr. Chairman. Looking back at the numbers, the graph that you gave us, do we have any numbers to look at corresponding population growth during those times?
If you know.
Mr. Chairman, Representative Penn, I don't have Wyoming population figures. We have access to tons of information, so happy to get you demographic trends and population numbers. I will concede, I'm sure that our population has increased somewhat.
Okay. Representative Clauston, and we'll go to Hornak.
Thank you, Mr. Chairman. You know, question with the Government Claims Act limiting it at $1 million. So do you have any information if a physician works for a hospital that's covered at the $1 million limit versus a physician who's in a private practice? Do we have any idea what the malpractice insurance difference would be?
Off the top of your head, good luck. Ready to go.
Mr. Chairman, Representative Clauston, no, I don't know the difference between them. I think it's a great question, and it's a really complicated answer. So if you are a full-time employee of that hospital, then the hospital is going to cover the premiums that would apply to you if anything happens. Some physicians have privileges at hospitals and may not actually be governmental workers, but the operating staff is. And then I don't know what the rates are for excess of like above the one, if it's going to be more. I do know that as the numbers go up, generally like an umbrella policy or something like that, the rates go down because it's so rare to have claims that exceed that limit that it's much cheaper as you end up higher than like the first amount of coverage, if that makes sense.
Yes, thank you. I guess the other thing on insurance that I'm concerned about, I hear from looking up at maternity care, people from Gillette said obstetricians are going to Spearfish because malpractice is cheaper. And people from Sheridan said obstetricians are going to Billings because malpractice is cheaper. Cheyenne, they're going to go to Fort Collins. The western part of the state, they may go to Utah. And all those states do have tort reform. So either from you or from someone else, if we could actually see what some of these malpractice insurance rates are in Wyoming versus these states that do have tort reform, I think that would be very helpful if you have any of that information or if you could get that for us.
Mr. Aronowitz?
Mr. Chairman, Representative, yes, we can get that information for you. And I left out a pretty important statistic. For every dollar that is paid by healthcare professionals to insurance in Wyoming, 17 cents is paid out. So it is the second lowest rate in the country. Alaska happens to be the lowest, but it's possible that our providers are being overcharged and that the rate should not be as high as what they actually are is a thought.
And maybe, I'm not sure, well, we can certainly ask you if you can find those rates, but perhaps other members in the audience have access to that information probably quicker than you guys might have to go dig if it's on your purview.
Probably, yes.
Okay. Representative Hornak? And then we'll go to Senator Barlow after that.
Thank you, Mr. Chairman. Well, first question, you mentioned Article 10, Section 4A and Section 4C is crucial. You mentioned, something to look into for a special session, but I don't understand your reference to Articles 10, Section 4A, because that's not in question in what we're doing here. Article 10, Section 4C, repealing that is. So just give me a little more clarification on what you meant by that.
Mr. Aronowitz?
Mr. Chairman, Representative Hornak, I think Section 4A is exactly what the ballot initiative would be, that the constitutional right is no law shall be enacted limiting the amount of damages to be recovered. And it's saying we want to change that. We want to have a limit on the amount that can be recovered. So it's undoing Section 10.4A.
Follow up,
Oh,
Mr.
yeah.
Chairman. So in Section 4C, there also is that language that it may be fixed by law according to the proper classification of various things. So how do we say we can't fix it in 4A, but we can fix it in 4C and still kind of, how does that get put together?
Mr. Aronowitz?
Mr. Chairman and Representative Hornak, great question. that's the foundation of the work comp system is 4C, that if you are injured at work, you're not going to get 100% of your lost wages. You're going to get 2/3. You're not going to get pain and suffering and loss of enjoyment of life at all. You're only going to get lost wages as part of the work comp system. So that part is in there and has been for a really long time. And it's why, decades ago, attorneys challenged work comp and said, this isn't constitutionally, this isn't right. And the courts have been right. It's right, it's fine, it's in there. So that's why this would be just a sea change to undo that. And you could have a situation where every workplace injury, now you're fighting about non-economic damages and full economic damages. And that's why it's, like I thought, just a special session unto itself of such a huge issue to have in addition to the 10-4A issue.
Okay, follow up again?
Thank you, Mr. Chairman. So other states actually have their own independent workman's comp insurance through private insurance, correct? And so what do they do? Because Wyoming is very unique. We're one of, I don't remember, it's very few states that actually have our own workman's comp. Companies are required to pay into Wyoming workman's comp insurance. And we have a fund with over $2.6 billion in it, a very healthy fund with our workman's comp, which is good, which is a good thing. But our rates are the highest in the nation for what we have to pay in as far as businesses. And so I guess I'm curious because, I mean, we've got such a healthy fund that we've passed legislation to actually use some of that fund to do different things other than workman's comp, to train employees and things that have lost their jobs and stuff. So I guess my question is, what do the majority of the other states do that don't have this kind of a clause in their constitution? How do they handle things? And are there limits outrageous? What's happening in other states?
If you know.
Mr. Chairman and Representative Hornock, I'm not exactly prepared to talk about what other states are doing with their work comp programs or what our rates are with work comp compared to others, and perhaps Mr. Wolf would be willing to help me out a little bit. I'm supportive of our system, and it gives me comfort that it's run by a state agency as opposed to a private insurance company, because we've got protections for workers here within our system. And other states, when you have it run by private insurance companies, those are for-profit entities. They make more money when they deny claims. Not so here. And I think Mr. Wolf will back me up too. Like, the fund is healthy and it has 2.6 billion in it, or whatever number you just referenced, but a lot of that money is already accounted for the thousands of people that have ongoing claims and lost wage payments. So it might be 2.6 billion with 2.1 in liabilities of upcoming payments and wages and stuff.
Okay. Senator Barlow, still have a question? Nope. Other questions in the committee? Seeing none. Thank you for coming all the way down.
Thank you all. Great questions. Appreciate it.
Anyone else wish to testify on this bill? Ms. Bush? I would suppose the Medical Society and the physicians of the state have something to say. And then after Ms. Bush, we'll go to Mr. Mitchell online. But for now, Sheila, the floor is yours.
Thank you, Mr. Chairman. Members of the committee, Sheila Bush with the Wyoming Medical Society. As was mentioned before, this issue is not new to us. It was 2004, right before I started with the Medical Society, in fact, that this went to the people to vote on amending our Constitution. I want to offer that WMS has historically been supportive of tort reform and would continue to be. We would never oppose trying to address aspects of the liability climate in our state. That said, I'm not positive that this is the right thing to do today. there are other options. And in the spirit of trying to collaborate and do what's right and honor the testimony prior to me speaking, there might be some value in looking at some other options. Before I go into those, I wanted to again reiterate that we're surrounded by states with some aspect of tort reform. I have all of those specifics, exactly what each of those states caps, the way they cap them, the amounts. It's pretty complicated, and it's probably not worth everyone's time for me to go into that this morning, but I do have all of that data. The American Medical Association tracks that really closely. I also feel like a lot has changed in the last 20 years since we took this issue to the voters of Wyoming. In 2004, there was not a high number of physicians who were employed by facilities or hospitals. Now a disproportionate number of physicians are employed by those facilities, which has changed the liability climate somewhat in the sense that hospitals self-insure their physicians. It's a little bit of a different puzzle than it was 20 years ago when physicians went to a company individually, negotiated a premium and a policy, and then wrote a check every year. So that is different, and it may influence what impact tort reform would have in the state. The second piece that I would offer is I think it has traditionally, one of the goals of tort reform has been to reduce the amount of defensive medicine that gets practiced. Defensive medicine is really expensive, and defensive medicine is just loosely defined as anytime a physician maybe orders an extra test or goes an extra effort in any way, not because they really believe that there's potentially a problem, but because if there were a problem and they hadn't done that test, and it was later discovered that they missed something, that creates a lawsuit. And that creates a great deal of fear among providers. They don't want to miss a diagnosis. And so sometimes that's one of the consequences of having a really litigious environment, which is what tort reform seeks to address. So getting into some of the other options, and we don't have to discuss them in detail, but if any of them are of interest, we'd be happy to have that conversation. Some include early disclosure and compensation programs, standard of care protection acts, liability safe harbors for the practice of evidence-based medicine, a regulation of expert witnesses in medical injury cases and actions, and requiring affidavits of merit in actions against healthcare providers for damages when rendering or failing to render healthcare services. And then finally, I'll just follow up on a couple of things, questions or comments that were made previous. I think it's really hard to quantify the exact number of physicians practicing in the state. Representative Ward, I think you asked for the last 2 years. Their graph stopped at 21 maybe. I can try to also get that. It's really hard. Because we don't differentiate license type within the Board of Medicine, all physicians who carry a license in the state are listed the same, whether or not they actually practice here or not. Some of them are doing telehealth. Some of them aren't actively practicing anymore, but they just keep their license active, those kinds of things. So it's a perennial problem of us not having a great idea of the exact number of physicians who practice here, but we can sure work to try and get that for you. And then to the previous comment about maybe looking at our Governmental Claims Act, I think that there's a lot of value in that, and we'd love to be part of that conversation if that's the will of the committee. And then earlier was a question about malpractice rates here in comparison to surrounding states. I don't have that off the top of my head, and I didn't bring that as part of my testimony, but I can absolutely find out.
Okay. Questions from Ms. Bush and the Medical Society? Seeing Representative Hornock.
Thank you, Mr. Chairman. Are the workman's compensation rates here in Wyoming for healthcare workers higher than other rates in other states? Where do we rank in Wyoming?
If you know, Ms. Bush.
Mr. Chairman, Representative Hornock, I don't know that. I can certainly, I can talk with you afterward and get the question specifically and then work on finding the answer, but I don't have it.
Anyone else? Seeing none. Thanks, Sheila.
Mr. Chairman.
Barlow, go ahead.
Thank you, Mr. Chairman. So within the current constitution, there's an alternative dispute resolution and the review by the medical panel. Those were both put in the constitution and in the statute. And then also in that same time frame, 2004, and certainly I wish Senator Dockstader was here, and of course Chairman Swanister was here then too. But I believe there was a malpractice pooling system or a state pool system too. And I guess my question is are any of those being used, or have any of those been used historically? Thank you, Mr. Chairman.
Ms. Bush, go ahead.
Mr. Chairman, the second part, I don't believe that we use the expert witness, or not expert witness, the, why am I blanking on what you said last? Yes, thank you. We repealed it in yeah, I think so. And there were a number of concerns with it, both in its structure and the utilization, and people kind of gaming it in different ways. It wasn't super effective. I don't think that that means that the concept is bad. If we wanted to revisit that, I think the language still exists in the Constitution. We just sort of repealed the structure around it. So I don't know that bringing it back would be very difficult, but it's not used now. And the pool is something I just learned about recently, despite being with the Medical Society for almost 20 years, which I would use as indication to say it's not used. And I don't know the reason for that, or if it could be improved and used more. But I'm woefully short on info on that pool.
Okay. Further questions for Sheila? Seeing none. Thanks, Mrs. Bush. Dr. Mitchell, are you still available? I know you had your hand up. You are. Floor is yours.
Yeah, so I just want to thank Mr. Chairman and the committee members for allowing me to talk. I don't know that I can add too much to what Sheila Bush said. I think if you ask physicians, they would be in support of tort reform. I think that one of the things I think you're going to see over the next 5 to 10 years, the AMA is forecasting that there may be a shortage of 80,000 physicians by 2035. And I know the average practicing orthopedic surgeon is 59 years old, and as well, that's the median number as well. And my personal feeling is I think over the next 5 to 10 years, as those physicians retire, I think there's going to be an increasing competition to try to recruit new physicians to the state. And I would disagree a little bit. I do think the absence of tort reform is not a positive factor in recruiting physicians to the state. And if you're trying to recruit people, if you're in the state and you're trying to recruit people, you don't talk about tort reform because we don't have it. If you happen to be in Colorado or one of these others, then that's a recruitment that you talk that, if somebody's considering Wyoming, you say, well, Wyoming doesn't have any tort reform, but we have it here. But I do think there's going to be more problems trying to recruit people as people retire. I also gave you some information from the AMA, and it just goes through the surrounding states. Just about every state that surrounds us has a cap on non-economic damages. I think if you look at Idaho, when the committee was talking about punitive damage, they actually specify, I think it's felonious or willful misconduct. Whether that would actually make the bill any better, I think I would leave that up to the committee members. I also put in there that when you look at the malpractice lawsuits, you have to look at whether they're claims or whether it's money paid. I found an article that showed that Wyoming actually ranked 5 as far as the claims made against physicians. But if you look at the actual payment, it's actually more average. And that may just reflect that with no tort reform, there's just more lawsuits filed, and as a result, more thrown out, and the ones that are left are the ones that they make payment on. I am going to send you. I think I'm going to try to send you an article. I found actually an article on the effect of malpractice reform on premiums, and in this one it says the Congressional Budget Office in 2004 found that caps on damage awards reduced the number of lawsuits filed, the value of awards, and the insurance costs. In 2009, a National Bureau of Economic Research paper was the first major study to conclude tort reform can reduce healthcare costs in the aggregate. this study used MEPS data and came to a similar conclusion. They found that it reduced, it depending on the number of factors that were included. If you looked at 3 reforms that were included, it reduced premiums by 2.7%. And if you looked at employer contributions to healthcare premiums, if you had 3 reforms, it reduced those by 4.6%. I'm going to send that article to you if you haven't already got it. I'm having problems with the Zoom. As soon as I try to do something different, it kicks me out, and then I have to restart my computer. So I will, as soon as I'm done talking here, then I'll send that article to you, and you can have that to review. I'm not an expert on tort reform, but I was in private practice up in Casper. I was at Casper Orthopedics, so I was in private practice for 16 years, and I still do some part-time orthopedic work. And certainly, if you have questions about specific things, I can try to find articles for you. But I think most physicians would be in support of tort reform. It's just a question of how you go about it.
It's very true. Thank you. Any questions for Dr. Mitchell? Not seeing any, but we will, I'm seeing Senator Hutchins. Go ahead.
Thank you, Mr. Chair. Mr. Mitchell, thank you for your input and your graphs and your charts. Just wondering, you say most physicians would be for tort reform, and you're saying, okay, but how are you going to go about it? What do you think about this bill in particular? Thank you.
Dr. Mitchell, thoughts?
Mr. Chairman, Senator Hutchins, I would, if I had to critique the bill, I don't really understand exactly what's being talked about as far as workers' comp, so I'm not going to address that. But I think the bill, if you wanted to retain the punitive damages, then I think specifying the conduct that would result in punitive damage, similarly what they did into Idaho. If you look on the Idaho, that AMA chart, they specified felonious, willful misconduct, something that would identify the conduct that would trigger the punitive damages. Those would be my thoughts on the bill.
Any questions? Seeing none, we'll look forward to that information. We can get sent to the committee. Appreciate you taking some time out of your day to be here today, certainly. Other public comment on this bill? Going once, not seeing anybody else online, going twice. All right, we'll close public comment. Committee, any action on the bill? Going once. Go, Representative Hornock. Motion moved by Representative Hornock. Is there a second? Seconded by Representative Penn. Discussion, Amendments Committee. Going once. Representative Clouston.
Thank you, Mr. Chairman. I guess I'm just not real comfortable right now with the effects on the workman's comp changes. I think we'll need to look at that a little bit more closely. So whether we move this bill or not, that's a little bit of a hiccup for me.
I would say with the constitutional amendment, it's not going on the ballot until more than 2 years away. So this future committee would have more than enough time to really look at the ramifications and the effects and how it plays out in the entire system, what else would be needed for workers' comp and the statutes, maybe before taking this step at this time. But I certainly think it is a worthwhile conversation we've been having for 20 years, and we're going to get there eventually. Other thoughts? Representative Ward.
Thank you, Mr. Chairman. I'd like to counter the argument that this violates people's constitutional rights under the Wyoming Constitution. In contrast, it gives power to the people to amend the Constitution as is afforded to them in the Constitution. Therefore, it does not violate their constitutional rights. A vote for this does not a vote to violate citizens' constitutional rights. I want that made clear.
Very fair. Other thoughts, committee? All right, seeing no further discussion and question being called. Katie, if you'd call the roll on making this resolution a committee bill for the 2025 session.
Mr. Chairman, this is roll call for 25 LSO 0136, limitations on damages for personal injury or death. Senator Barlow?
No.
Senator Bouchard? Excused. Senator Dockstetter? Excused. Senator Hutchings?
No.
Representative Chadwick? No. Representative Clouston?
No.
Representative Hornock?
Aye.
Representative O'Hearn?
No.
Representative Penn?
No.
Representative Trujillo?
No.
Representative Ward,
Aye.
Representative Yin,
No.
Co-Chairman Baldwin. Chairman Zwanzer,
No.
2 aye,
All right.
10 no, 2
10 no.
excused.
With that, we're only running about 22 minutes behind, which is exciting. Next up is placard and plates follow-up.
Mr.
First
Chairman.
up, Senator Barlow.
Mr. Chairman, so I do think out of this conversation, there were a lot of things brought forth. The Medical Society in particular brought several things forth. So as an individual member, if there's an interest, I would certainly be glad to continue the discussion about some of the alternatives that are out there. And I want to be clear on the workers' comp. While we do have a workers' comp system, I also understand there are frustrations with having a state-centric system. And I'm sure some of you have heard constituents about some of the way claims are handled there. So just because we have a system doesn't mean it's perfect. There's still improvements, but if there's more to be done on this topic, Mr. Chairman, I just want to be clear. I think we should continue to look at it. It's a big conversation, and I'll certainly, if there's folks who want to pursue it, I'll certainly be glad to be a part of those discussions. Thank you, Mr. Chairman.
Thank you, Senator Barlow. And again, those of us who've been around for 20 years remember when the fund was at dangerous levels and the legislature put multiple safeguards, shall we say, that I guess quickly worked, and it is now much more robust in very quick order than it was when we were at critical levels here about 18 years ago. With that, moving on to 25 LSO 133, handicap placards, healthcare providers approval. Thank you very much, Director and Deputy Director, for being here. Director of Insurance left. Anybody else need to leave now? We'll give you 30 seconds before we start the next one, I know. We'll let some shuffle go on. While the room is shuffling around, we're going to take up 25 LSO Working Draft 133, handicap placards. Is this yours, Anna? If you'd go through the bill with us.
Thank you, Mr. Chairman. This bill draft is entitled 25 LSO 133, handicap placards, healthcare providers approval, and it's version 0.4. This bill draft amends Wyoming Statute 31 to 213C to allow any healthcare provider, including physical therapists, to provide a letter for a person to get a handicap placard from the Department of Transportation. The staff comment on page 3 provides the definition of healthcare provider and physical therapists that are used in the bill draft. Section 2 on page 3 provides an effective date of July 1st, 2025, and that is the bill. And I would stand for any questions.
Questions on the mechanics for LSO? Not seeing any. Senator Barlow, go ahead.
Thank you, Mr. Chairman. So I just want to be clear, because the bill reference is with the definition of healthcare provider is referencing Title 33. It's kind of a strange place for that definition to be, but that's where we're referencing. It seems to me that it already includes physical therapist by definition. Physical therapist is already there because Title 33 is basically all of the healthcare licensure statutes. So I guess my question is for LSO, notwithstanding the fact that maybe this was requested by someone who is a physical therapist or had this interest, does healthcare provider already include by default physical therapist? Thank you, Mr. Chairman.
Sure, thank you. Anna, go ahead.
Thank you, Mr. Chairman. Senator Barlow, I think that it could include physical therapist, but the language is added just to make it abundantly clear that it does.
Makes sense. The pharmacists have left, so if they're a healthcare provider that can issue handicap plates, they don't seem to have stuck around for this one. All right, committee, Representative Clouston, go ahead. This, I think, was from you originally, so thoughts before we open public comment?
Yes, thank you. I'll just bring the history of this. So currently, when you look at applying, it says you can apply completed by either your physician or advanced practice registered nurse. So we had a situation where a podiatrist did surgery on a Friday. They needed a temporary handicap sticker for their patient. Came to my building. Either the podiatrist, the physician assistant, or myself could write for this. So just looking for better access for our patients when they need it. All of you got a handout. It lists on what it takes to get the certification, and it's really straightforward. It also includes visual impairments and audio impairments. So make sure the optometrists are considered a healthcare provider, audiologist. So all those should be in that definition of healthcare provider that are licensed in the state of Wyoming.
All right, we'll open it to public comment. I know the
Chairman.
department's here. Oh, go ahead, Senator Barlow. But Misty, you can come on up while Senator Barlow's asking a question.
Thank you, Mr. Chairman. So just to the comments of my colleague, Representative Clausen. So do we have to have specifically physical therapists there, or? And then if we don't, do we have to include everybody else in the list that I think he assured us that we're already part of it? So my question is can we just clean it up by getting rid of the specificity of one particular licensure and healthcare provider covers them all, or should we actually list them all out or do something else that's decisive? Thank you, Mr. Chairman.
Thank you, and Representative Clausen, maybe think about that. If the bill moves, we'll amend it and have that discussion at the appropriate time. With that, welcome, Ms. Zimmerman. Floor is yours.
Thank you, Mr. Chairman, members of the committee. My name is Misty Zimmerman. I work for White Hop and I'm responsible for the driver services program. I think as this bill comes before you today and the discussion that we've had in previous bills, the definition of healthcare provider is very broad and it may be difficult to determine who in fact has the ability to determine if in fact a person is eligible. When you look at Section D of this same statute, it talks about the secondary piece of this, which what is that criteria that makes that person eligible, excuse me. So when you look at a healthcare provider as it's defined by statute, that could be anybody who is licensed, certified, or otherwise authorized or permitted by law to provide care, treatment services, or procedures to maintain, diagnose, or otherwise treat a patient's physical or mental condition. My fear is that this definition is very broad and that not all persons that are included in this definition may have the ability to determine that a person is eligible under Section D. So I would just ask that the committee take that into consideration as they consider what is an eligible person, or excuse me, what type of person can determine the eligibility of this. I do agree that there is some necessary growth in what the existing statute is, and just would ask that we walk through that process and determine what exactly that looks like going forward.
Because otherwise in 31-118B1, you could have a school nurse, a social worker, or psychologist. I mean, it does kind of open it up a little too broad for people who could hand out plates. I can see your point. Questions for Ms. Zimmerman? Representative Clausen.
Thank you, Mr. Chairman. And so I have the same concerns. I mean, as a physical therapist, I'm not going to write one for someone who has hearing or visual impairments, right, or cardiac impairments probably. But if they come in they're in a wheelchair or they're using crutches and they need one, that's something I can easily determine. So what do you think about, some language in there that says within their specialty area?
Go ahead, Ms. Zimmerman.
Chairman Zwanzer, Representative Clausen, I do struggle a little bit with also the ability to give proper guidance to my staff to ensure that across the board that it is being maintained consistently. Because again, within their specialty is very broad and it may not be able to be determined by the examiner that's sitting in the front counter in Sheridan or Gillette or Basin or those types of those scenarios, or even in our back office where we have to deal with it on a daily basis. So I do think that we have an additional inclusion in our statute for the visual and audio impairments, which is not included in the federal regulations either. So I do think it is important that we define those things or those specialties that can do that. And I think, in the June meeting, I did provide you with the information about the surrounding states. And I would encourage us or you as a committee to determine what that looks like, and we'll move forward with whatever your decision is. And we do understand that as this bill may move through the session, that additional specialties may be brought up, and we can work through those as they come.
Representative Hornock.
Thank you, Mr. Chairman. I guess, do you know of situations, seems where this would help people? It seems to me like somebody is in a wheelchair, somebody's on crutches, like we've heard the example of. Seems like those people are taken care of somehow or another. It seems like the physician or advanced practice registered nurse would at that point figure out a way to get them a placard or something like that. So I'm curious if you know of example, do you think there's a gap? Because I think in one thing that may happen with this bill, if we open this up to certain definitions of state statute, we're talking about people who can treat or diagnose patients with any physical or mental condition, which means sleep apnea, which means ADHD, which means Tourette's, which means whatever that is, any physical or mental condition that can be treated or it opens the door to anybody requesting those kind of placards. And maybe that's fine. Maybe we want to go that way because I'm in the Home Depot parking lot a lot. None of the handicap spaces are ever filled there, so who knows? But, if we're talking about somebody who just wants an avenue to park closer to the Walmart door, that's another story. But it seems to me like we have a method of taking care of the people that actually need it. Do you find that to be true, or is there a gap in things that we should open the door up a little bit?
Go ahead.
Chairman Baldwin, Representative Hornak, I wouldn't be the place that we would see that gap. Driver services would simply be the person that would process the application. I think maybe members of this committee would have a better answer for that, but we don't see that gap there because we are getting the form completed by the persons that are currently eligible.
Thank you, and I believe Representative Clausen pointed out that gap that's there right now and has a better answer for that, but there is a gap. Further questions, committee? Go ahead, Representative Penn.
Thank you, Chairman Baldwin. I agree that the definition that we're using here is very broad. It would include a CNA at a nursing home and so I think what we have already is pretty good. Maybe there's a gap. I think what Representative Hornock was saying is, generally we think of going to our doctor to get these things. Maybe in Wyoming, especially where people don't require a referral to see a physical therapist, they may just seek out physical therapy on their own. It might be appropriate to just add physical therapy therapists to what it currently says. So it would say a letter from his physician or advanced practice registered nurse or physical therapist. We might consider adding physician's assistant because I think those generally would cover where people are going to be seen for these types of ailments and treatments. And would that suffice, do you think?
Comment, go ahead.
Chairman Baldwin, Representative Penn, I would also add because of in section D, Romanet 2G, it does account for audio and visual impairments that may also limit the ability. So I would just suggest that the committee maybe make recommendations to accommodate that because not every person may see one of the specialties that you mentioned for those types of ailments that would impair their ability to walk.
Follow up?
Tell me where you just saw that, or give me that reference again, please.
Go ahead.
Chairman Baldwin, Representative Penn, it's not in the existing bill draft. So in section D of 312213, it says as used in this section, and then it says an eligible person means a person with disabilities which limit or impair the ability to walk as determined by a licensed physician or advanced practitioner and practice registered nurse, including, and then Romanet 2, letter G includes a severe visual or audio impairment that limits a person's mobility. So I do have copies of that if you would like it.
Further questions, committee? Seeing none right now. Okay, seeing none right now, we'll let you take a break, but don't wander too far. Anyone else who wishes to comment to the bill? In the room, going once. Nobody online? Going twice? Gone. Committee, what's your pleasure? Bill moved. Seconded by a couple of people. We'll give it to Mike again. Okay, let's talk about the bill. Committee, comments, discussion, amendments, and I'll turn it back. Senator Barlow, go ahead, sir.
Thank you, Mr. Chairman. So when you look at the section D, which folks have been talking about, eligible person, that's actually quite instructive about, to me, it's the inability to walk. That is it. Limit or impair the ability to walk. And then it goes through the criteria, inability to walk 200 feet without without a cane or assistance, et cetera, oxygen, cardiac condition, et cetera. So I think the healthcare provider definition is far too broad. And I don't know all of them, but I think we limit it to adding what I think Representative Penn talked about, adding, this would be my motion, is to add physician's assistant, physical therapist, and I would also argue occupational therapist. And then I don't know what the right terminology would be for the hearing and visually impaired. So I would offer a motion to strike healthcare provider, reinsert the physician, advanced practice nurse, and then also add physician's assistant, physical therapist, occupational therapist for this motion, and then we'll deal with the other disabilities in another way. Thank you.
We'll consider that a motion, seconded by O'Hearn. Didn't even get it out, and Kevin's on it. All right, Representative Clausen, go ahead. We'll go to Hornrock.
Thank you, and I agree with that motion. I would also like to add podiatrist. I mean, if they're doing a foot surgery and someone's in a boot, I'd like to see them added. If they can do surgery, I think they can write
They'd
for
be a physician though, right?
So in Wyoming law, it's, when I looked it up, physician is a medical doctor and a doctor of osteopath, but podiatrist is not included.
Is
No
that
harm.
Okay, friendly, Representative Hearn. Okay. So Anna, you're the one, you got that? So physician assistant, physical therapist, occupational therapist, podiatrist. Okay, Representative Hornock.
Thank you, Mr. Chairman. Question for that on the occupational therapist. Can you provide some justification for an occupational therapist? I can see the others, but not certain about that. When you mentioned the qualifications about being physically impaired and you're walking and having to walk a certain distance, I'm not certain about the occupational therapist where how that would be included. Just curious.
I guess that might be to you, Senator Barlow.
Thank you, Mr. Chairman. And I guess I don't know the entire scope of practice. I think it still comes back to the section, or that section of statute. It'd still be restricted to do they have the ability to walk? So an occupational therapist, if they're dealing with some injury, but I don't know the scope of practice occupational therapist. If it's inappropriate, I'm fine to take that out. I just felt in a lot of settings, occupational therapists and physical therapists work very closely together. So maybe this is a better question for, our colleague, Representative Clouston, or maybe there's someone else in the audience. But I'm not opposed to questioning it. I understand the questioning of it. I just wanted to see if we could be inclusive, but it's fine. Thank you.
Thank you, Representative Ward. Go ahead.
Thank you, Mr. Chairman. Senator Barlow, when my dad had a stroke, an occupational therapist helped him get his skills back, and a stroke victim might not be able to walk because, well, strokes can affect, many parts of your body, including the ability to walk. So I think the occupational therapist, if I understand the scope correctly, would be able to treat folks who can't walk. Just a thought.
Senator Baldwin?
No, and I would add to that, it's a cognitive impairment as well, and the occupational therapist may deal with that more than some of the other folks. The occupational injury or the stroke or whatever injury that might be, it causes mental impairment that may limit this patient's ability to walk, to reason, to know where they're at. And so I think occupational therapist fits in fairly well.
So if this amendment passes, I guess I'm looking at Ms. Talbot, we would be sure to notify the Occupational Therapy Licensing Board, PA Board, just to let them know this is, hopefully they're all paying attention to what this committee does, but on case they don't, I just would like to make sure we have a note to notify that an amendment got offered if it passes. Senator Barlow, go ahead.
Mr. Chairman, just to be clear, the way the bill is drafted now, all healthcare providers should be on notice. We're actually limiting it back to, I think, ones that we think are hopefully the most appropriate ones. So I understand what you're trying to say, but right now, if they're not on, if every healthcare provider in the state of Wyoming should be paying attention to this right now because they would be eligible for this. We're actually, I think, with this amendment, limiting it back to, I think, the ones that are most appropriate in this setting. And with the, like I said, going back to the eligible person, and I appreciate Representative Ward's comments. I think they do fit under that definition. Thank you.
Thank you. I agree. I just don't see that we had a huge turnout from all the other boards and commissions on this one. So I hope they're paying attention as they should be, but in case they're not, just we would notify them if this amendment passes. Any other testimony on this amendment? Seeing none, all in favor of the amendment say aye. Aye. Opposed say no. That amendment passes. Other amendments or discussion, committee? I can't, Representative Clouston?
Yes, thank you, Mr. Chairman. So reading through this bill, and Anna, correct me if I'm wrong, but this looks like it's only dealing with the 12-month and longer permanent. I think we need to add the temporary, and I think that's really where this bill is probably needed more, is in the temporary placards.
Do you have an amendment for that, or we're asking LSO to double check? This is for the permanent placard, but we also want to make sure we're covering the temporary tags, which may not be covered in this section. Is that how you read it as well, Ms. Zimmerman? Line 11. Oh, then is, well, or to any person.
Mr. Chairman.
Go ahead, Anna.
I mean, it looks like it just applies to the 12-month one, or a disability that would last at least 12 months.
Mr. Chair.
Senator Hutchins, go ahead.
Thank you, Mr. Chair. The way I read this, having had the placards, normally temporary one is going to be 12 months, at least 12 months, a year. And the permanent ones, or more permanent, are 10-year periods. I guess the Department of Transportation can verify that, but this looks like it does include the temporary, because it says a minimum of 12 months.
Ms. Zimmerman, can you just check?
Clarify, thank you.
Can you clarify where we are and if you think this needs to be for temporary tags as well, or if this is the same section when you deal with this area?
When I found it.
Okay, we'll get on it first, but don't go too far. Go ahead.
So, Mr. Chairman, temporary ones are covered by subsection G and H. It says that the same conditions as provided in subsection C through E apply. So that goes to the temporary ones as well, so everything should be covered.
So this does cover both. Okay. I like when everybody agrees in this committee. We're all smiling and nodding. It's good. Let's keep that up. Any other discussion or amendments? Seeing
Mr.
none.
Chairman.
Senator Barlow.
Thank you, Mr. Chairman. So I want to revisit or suggest if anybody wants to revisit the hearing or visually impaired language, and the way the discussion is in this currently is if that loss of hearing or vision impedes their ability to walk, basically. So are we, I mean, what I guess I'm saying is, do you want an audiologist or someone else to be able to do this, or are we comfortable with the range of current folks that we're going to expand this ability to. I'm just throwing it out there because it came up in Ms. Zimmerman's discussion that Wyoming goes a little further than the federal law when it comes to hearing or visually impaired, but it's still specific to mobility. It's not deafness, it's deafness that impacts someone's ability to be mobile. Thank you, Mr. Chairman. So I'm throwing it out there if anybody is concerned about including that. Thank you.
I'm not sure we should include it at this time, but certainly in the next 4 months, if our boards and commissions check with their members and there's a good case come January, February, I would hope that they would come forward and make that case. But yeah, it does seem difficult for an audiologist to tell someone they can't walk correctly, or someone visually impaired may or may not be appropriate to be driving a vehicle. So for now, I think we should leave it, but that's my thoughts. If anybody wants to make an amendment, certainly do.
Just
Representative Penn.
question, Chairman, thank you. So on what you just said, I was just actually thinking the same thing. Are these certificates going to people who hold driver's licenses, or are these also going to passengers? Because like you just said, if someone is so visually impaired that they can't walk, that they probably should also not be driving.
Ms. Zimmerman, can you get a handicap placard for a non-driver for a vehicle? Go ahead.
Chairman Zwanitz or Representative Penn, the statute's pretty specific that it's for the responsible for transportation of a person that meets the qualifications of an eligible person. So we even have agencies that have placards for their vehicles because the persons that are being transported. So it is very possible to have a handicap placard or disabled placard for a person that does not have a driver's license within the state.
So perhaps perhaps Senator Barlow's argument comes strongly into effect if somebody does have other issues where they need to be in short distances to a location. But I'm not sure I'm ready to put that in right now, but we should certainly take it back. Representative Clouston.
Thank you, Mr. Chairman. And just, no one's more qualified on the visual aspect than our optometrist. I mean, they have someone in their office that day, right? Versus sending them now, someone with visual problems, trying to go see another professional just to get this taken care of. So I would like to add the optometrists to the list of providers, if that's a friendly amendment to everyone. And
Are you going to start that with I move?
I move to add an amendment to add the optometrist to the list of providers. Yeah, they should be in there. So I think it'd just be adding the optometrist to the list of providers.
Mr. Chairman.
Senator, let me see if there's a second first.
Second.
Seconded by Barlow. Go ahead, Senator Barlow.
Please add ophthalmologist, because I don't want to have that discussion. Optometrist and ophthalmologist. Thank you.
We believe the discussion is an ophthalmologist is already a licensed.
They're MDs.
An MD, so they would be covered. Now, if somebody wanted to add chiropractor, we could certainly have this debate go on for a while. But for now, we are on optometrists. Representative Hornock, go ahead.
So just asking for some clarification. In the original amendment that passed, didn't we include whatever the optometrist and audiologist in that? So I thought this was already covered, basically. We're just kind of discussing whether or not this should remain.
I believe, Representative Hornock, we moved it back to the current definition and then started adding certain professions onto it. Would that be correct, Anna?
You've only added physician assistant, physical therapist, and
Into the mic.
occupational therapist.
One more time, everybody heard that? Okay. All right, so on optometrist, we're okay with that optometrist in the back of the room? Okay, just checking. All those in favor of the amendment, please say aye. Aye. Opposed, say no. Wow, too early today, Senator Baldwin. All right, we're back on the bill. Any other amendments for today? Seeing none, bill being moved and Representative O'Hearn calling the question. Katie, if you'd call the roll on making too many forms up, but this is 25 LSO 133, a committee bill for the 25 session.
Mr. Chairman, this is roll call for 25 LSO 0133, handicap placards, healthcare providers approval as amended. Senator Barlow?
Aye.
Senator Bouchard excused. Senator Dockstetter excused. Senator Hutchings?
Aye.
Representative Chadwick?
Aye.
Representative Klauston?
Aye.
Representative Hornock?
Aye.
Representative O'Hearn?
Aye.
Representative Penn?
Aye.
Representative Trujillo?
Aye.
Representative Ward?
Aye.
Representative Yin?
Aye.
Chairman Baldwin?
Aye.
Chairman Swanser?
Aye.
Two excused.
Just great when it's unanimous. We get that so rare around here. With that, committee, we're on the 25 LSO 138, which is disabled veteran license plate choice. LSO, if you just remind us and go through it real quick, is that you, Luke? Okay, go ahead, Mr. Plum.
Thank you, Mr. Chairman. This is 25 LSO 138, disabled veteran license plate choice. Currently within statute for disabled veterans, they can receive the disabled veteran license plate, or under subsection E of Wyoming statute 31-2-215, they could, how the law currently is that they can choose, instead of the disabled plate, to receive a plate that relates to their service in the military. This bill draft just changes E a little bit and essentially allows a disabled veteran to select any, in removing distinctive license plates, so they can elect to receive any license plate authorized by this article for which the veteran qualifies, to open it up to allow them to choose any other plate that they wish and that they would qualify for. But yeah, and then this bill includes an applicability section in section 2 for any applications made or renewed for disabled veterans license plates made after the effective date of the bill, which is July 1st, 2025. And with that, I would stand for any questions.
Thanks. Any questions for LSO? Seeing none. I don't know if there's any public comment. I know Ms. Zimmerman is here. Oh, hey, welcome. Floor is yours. Ms. Lopez.
Good morning. Debbie Lopez with the Wyoming Department of Transportation. Thank you, Mr. Chairman. Debbie Lopez with the Wyoming Department of Transportation Motor Vehicle Services Department. We handle the license plates for the state of Wyoming. Our only comment on the bill is that for all the others, for all the specialty plates, there is a $30 YDOT fee, which there also is for the veteran plate that they're receiving free. The veteran plate also has a $20 additional fee that goes to the Veterans Commission, and so that's all waived with the free DV plate. If we add every plate to this list, we have 3 plates that have an additional fee, like to raise money. The University of Wyoming has a $100 application fee that goes toward scholarships. The tribal plate has a $70 application fee that goes toward scholarships. And then the wildlife fee has a $150 application fee in addition to a $50 annual fee every year that goes to wildlife conservation situations. So we just wanted to verify that that's how you wanted this plate to be, that because it says in the line 13, no additional fees shall be charged. So was it the intent that they not pay the money for the donations to the UW Scholarship Fund or the Tribal Scholarship Fund or the Wildlife? I stand for questions.
Thanks. And I mean, in my talks with them, and I don't see them here today, the issue is really about not having to have a disabled plate or the word veteran if they thought they were being targeted, or, but I'd never heard the discussion if they wanted a specialty plate, would we waive that fee for them? So I'd never heard that from them, but that's the question before us, is what you're saying is, right now the statute says they get a free license plate, but the question is, would we allow them to have a free plate that otherwise gets charged an additional fee for conservation or UW? And there's no statutory protection anywhere else for that. Okay. Representative Hornock.
Thank you, Mr. Chairman. That's a great point. I'm glad you brought it up. And correct me if I'm wrong, anybody actually, but I was under the impression when we talked about this at our last meeting that we were just talking about, rather than getting a disabled veteran plate, they could qualify for any military plate. So if we left in the language on page 2, end of lines 5 and 6, basically, then that's what we were talking about. I wasn't, I don't know, and maybe I missed the discussion or was off in La La Land somewhere else, but I didn't know it would apply to any particular plate that Wyoming offers.
I think that's correct, and that was the testimony I remember as well. And so if there's a way to, when the amendment process comes up, to put some sideboards on this, I don't believe that would be a concern. Other questions for YDOT? We have Ms. Lopez. Go ahead, Representative Clouston.
Thank you, Mr. Chairman. I guess I'm, of the opinion that if we have a disabled veteran, they can have any plate they want. We can waive the fee, that they've earned that. So with these specialized plates, these extra fees, if we don't collect those, is there a real harm to any of these specialty groups that we're looking at? Do you feel like the legislature would have to backfill that, or we could just ignore it if they're a disabled veteran?
That's a little bit of a policy question, but Ms. Lopez, thoughts?
Mr. Chairman, Representative, I think you'd need to talk to UW or the Wildlife Commission, who's, do they want someone to have their plate when they haven't donated to why the university or the wildlife? Do they want them to have, I don't know. It really isn't YDOT.
Senator Hutchins, question?
Thank you, Mr. Chair. Kind of comment is, for me, I'm going to comment on and against this bill. I have 4 veterans in my house at this moment and discuss this particular question. What I think the veteran, who to me should have been in attendance today, because this is just one veteran that I've ever heard of in all my time wanting this particular situation, where he wants to come in and he wants to receive a plate. I don't think he necessarily wanted to receive a specialty plate. He just wants a plate that doesn't identify him as a disabled veteran for some odd reason. To me, you should be proud to display your plate that the state has given you for free and be honored that you're displaying you are a disabled veteran. I see no problem in that. So for me, this has nothing to do with the other specialty plates at all. It's just one person out of the thousands and thousands of veterans here in the state that said, well, I don't want my plate to be a DV plate. I just want it to be a free plate. So that's what I understood. And I think if this was so important to this veteran, that he should be here to testify on behalf of this bill. So again, I'm on and against the bill.
I don't know if that was actually a question to you, Ms. Lopez, but certainly material for the committee to consider. Other
It was
questions?
answering her question, I think, Mr. Chair.
The question that I think Ms. Lopez, I guess the question is, have you heard any different? Right now, the concern is a disabled plate from a disabled veteran has to say disabled on it. And I believe the concern was they didn't want to be listed publicly driving around having a disabled plate. I don't know if you heard that from anywhere else, or is this the first time it got brought to your attention from this committee? How many people have complained those type of questions, if you know?
Mr. Chairman, the way the law is currently written, you can get either the free plate as your DV plate, or you can pick any of the military plates that you qualify for. So the people that don't like the DV on the plate will typically get their Air Force or their Army or their whatever other plate they're qualified for. So no, I have never heard anything until the last time I was here.
Senator Barlow, question?
Thank you, Mr. Chairman. So this, I just want to know, and this is for LSO, the striking, going from chapter to article, I don't think that changes anything. If we don't, do we need to do that if we don't make this change? Meaning, does that article, the chapter change on line 5, is it material in and of itself to this discussion? Thank you, Mr. Chairman.
LSO, if you know, Mr. Plum?
Mr. Chairman, Senator Barlow, I don't really think so. It's the chapter regarding registration of vehicles, but all of the license plate specific information is contained in this specific article. And so that's just why we made that change. But no, I don't believe that it would impact, if this bill were not to pass, it wouldn't have any impact on the current scheme of the license plates.
Thank you.
Other questions for YDOT? Go ahead, Representative Hornock.
Not sure if this is for YDOT, but in order to receive a disabled veteran plate, do you need a certain percentage of disability? Is it 100% disabled veteran, or is there a different status to receive the DV license plate?
Ms. Lopez?
Mr. Chairman, Representative, based on Wyoming statute, to get this license plate, you're a disabled veteran who received 50% or more service-connected compensation from the U.S. Department of Veteran Affairs, and you have to be a resident as well.
50%, okay. Other questions for YDOT? Seeing none, thank you for being here. Other public comment in the room on this bill, 25 LSO 138. Double check the Zoom. Not seeing anyone else. So we'll close public comment. Committee, what's your pleasure? Moved by Chadwick. Is there a second? Seconded by Yin. Discussion amendments committee. Do you think we should have an amendment that, I can appreciate Representative Clausen's thought that they're a disabled military member, they can get whatever plate they want, but that does come into play with what the university and the wildlife conservation. So I guess I would entertain an amendment to, and then maybe YDOT could help with the language on how to restrict it to a standard license plate. And I fundamentally think all veterans should be proud of their service, but I know there are some out there who don't want to say they're disabled and don't want their branch of the military on their license plate and did their time and want to move on. And lots and lots of veterans in Wyoming, and we owe them our thanks.
Mr. Chair?
Senator Hutchins.
I believe the lady from YDOT made it clear, or whatever office, that if they don't want a disabled plate, they can choose Air Force, Army, Marine. So they do have, sounds like a choice, and I think that should be sufficient. Just my input.
Appreciate it. Anybody, Representative Hornock?
Thank you, Mr. Chairman. I had an interesting discussion with a family member who's a lieutenant colonel in the Air Force. He doesn't necessarily like the disabled plates because it is easy to get. You can get them for sleep apnea. And so, there's just it's one thing to be wounded in the war, and we owe those type of people our debt of gratitude for sure. But, I was trying to look up what qualifies you as that disabled veteran status, and I'm not sure that we know enough to really figure that out in relation to passing this bill beyond what we already have, actually.
Okay. Representative Yen.
Mr. Chairman, so the amendment that I would offer, I move, Mr. Chairman, I move that we amend on line 5, after the word qualifies, we insert except, and I'm gonna need LSO's help on this, except the UW plate and the wildlife conservation plate, because I believe those are the only two that have a donation requirement.
Okay, LSO, you got that? Ms. Lopez, can you come up? I just want to make sure and confirm those are the only two plates that would otherwise have a fee, and maybe a catch-all for any plates in the future that the legislature might enact. But would that be correct before I ask for a second? That those are the only two?
Mr. Chairman, the tribal plate also has a donation on there, and we would like if they strike those for future plates that might have donations related to them.
Okay. Representative Yen, is that?
Mr. Chairman, yes, I would like to include all of that language.
Okay.
And I still need a second, I believe.
Yeah, tribal plates and then any future license plates that are, I don't know if they have a name for how we classify these, that have additional fees. I'm sure LSO could work on that language. Anna, you got that? Seconded by Representative Ward. Discussion on that committee. Representative Hornock.
Thank you, Mr. Chairman. Is there just a statute reference that we could throw in there instead of listing the exact things?
Ms. Lopez, do you know if we have a certain section of statute that has all the specialty payment plates?
Mr. Chairman, each plate has their own statute number, so the UW one, the tribal, and the wildlife are all different. I mean, if you need them.
And I'm guessing LSO would catch that in the future if we ever did enact what did we have, a breast cancer plate? We've had about 8 others that we've resisted that haven't made it through the process yet in the future, so. Oh, the organ transplant, yeah. So, always new plates. We're gonna turn into Colorado one of these days with like their 210. All right, other discussion on that amendment? Seeing none, all in favor of the amendment, say aye. Opposed, say no. That amendment passes. Other discussion or amendment committee? Anyone like to yell a word to start with Q? Question being called by Representative O'Hearn. Katie, if you'd call the roll on LSO draft 138 to make it a committee bill for the 2025 session.
Mr. Chairman, this is roll call for 25 LSO 0138, disabled veteran license plate choice as amended. Senator Barlow?
No.
Senator Bouchard, excused. Senator Dockstetter, excused. Senator Hutchings?
No.
Representative Chadwick? Aye. Representative Klauston?
Aye.
Representative Hornock?
No.
Representative O'Hearn?
No.
Representative Penn?
No.
Representative Trujillo?
No.
Representative Ward?
Aye.
Representative Yen?
Aye.
Chairman Baldwin? Chairman Swanser? 5 aye. 7 no, 2 excused.
With that committee, one less bill out of labor health from the interim. Right now our agenda, hey, we're caught up, well, by 11 minutes, but if we give a lunch break till 1:30, we'll see back to talk about maternity care and child care at 1:30. Until then, we're in recess.